contract in good faith, otherwise they would be at risk of breach of contract. Addressing the concerns raised after the bid closing, we have reviewed the purchasing policy and confirmed that it does not prohibit further interaction with the bidders once the bids are received. Since the Town Council is allowed to consider factors other than price, it is reasonable and legal for the Council to communicate with any bidder, informing them that they are the low bidder, but that the Council requires further information regarding their ability to fulfill the duties under the contract. Similar conversations could be had with any other bidder addressing any point of concern. To ensure transparency and provide equal opportunities, we are holding a publicly noticed workshop session where both United Ambulance and Lisbon Emergency will have the opportunity to walk through their submissions and answer any relevant questions posed by the Council. This approach will allow the public and each bidder access to the full process. If after these discussions, the Council decides to award the contract to a high bidder, it may legally do so, provided that an order with findings is adopted explaining why that choice is preferred. This method ensures that the concerns of all parties involved are addressed while maintaining transparency and fairness in the bidding process. That being said, I look forward to a transparent and productive workshop that addresses the concerns of all stakeholders. And then I'll kick it off to you, Dennis.
I have some handouts.
Sure.
How many of them do you need?
Give me 7 and 1 for the book. For 8, I'll have one.
6, 7. That should be 8. And I have a few more. I have some more. Okay.
Under my agenda. Oh, there it is. Lisa, are we going to do roll call?
We should do roll call, just so it's on record. Councillor Lunt?
Here.
Councillor Fellows?
Here.
Councillor Larochelle?
Here.
Councillor Keller?
Here.
Councillor Moore?
Here.
Councillor Robichaud?
Here.
Councillor Kane?
Here.
The first item on the workshop agenda is to start with the EMS services contract information from United Ambulance.
All right, sir. You can begin.
So I gave you a few pieces of paper, just kind of wanted to go through. I know there was some concerns at the last public meeting or town council meeting as far as some questions that possibly weren't clear in the bid, and then if there's anything else that you had any questions on, I'd be happy to answer those as well. So instead of reading through exactly that, I kind of took apart some of the questions that people had and put them together in that presentation that's in front of you. The other two pieces that we'll go over just quickly, just to give you an idea, is I did do a request for information from Maine EMS, and one of the documents, one of the packets that you have, are all of the 911 responses for your zip code. So for the town of Lisbon, as far as what the responses were, as far as how many responses, as far as what the data actually looks like. And then the other packet is what United has done in 2022. So both of those are for the years 2022 to give you some idea as far as what are the true numbers. Now, it is pulled from the MeFIRST system, or that's our medical record system within Maine EMS. So data in is as good as what gets put in from the providers, but it is what's billed, it is what's legal documentation and those types of things. So to give you an idea as far as how many emergency responses were recorded for your zip code, you have all that information so you can make some decisions as far as what's best for your town. So I just wanted to provide some of that objective data. It's from Maine. The initial one is from Maine EMS. That is for the town of Lisbon. The other one that says United Ambulance, Town of Lisbon, those are the responses that United did in 2022 to give you an idea of what we responded to and our response times and everything from that as well. So that gives you a full picture of what we did in 2022 in your town, and as well as what anybody did in your town, whether or not it was Lisbon, whether or not it was United. You even see some data in there for community paramedicine for the town of Lisbon and for ours, because we did some visits for community paramedicine within the town of Lisbon. So you'll actually see some various things within that data. So I just wanted to give you a chance to look at the objective data as well for your decisions. So a couple of things as we kind of go through with the proposal. We are accredited, which accreditation is an independent accreditation that they come in. They take a look at best practice, and they kind of go through. It's an independent group that actually does the accreditation, and CAS accreditation is something that we've done for many years, and we are proud as far as going through that process. It is an extra step that's not required, but it is something that we do at United. One of the other big questions that I know you have is staffing. Everybody in EMS has a staffing problem, right? Everybody in the country, there's a lot of people in the United States, right? We have made some big changes in the past few months that has me pretty darn excited as far as staffing for us, right? We are or have changed our hourly wages in the past few months. And also, just for background, I'm Dennis Russell, in case you didn't know. But I am newer to the operations management at United. I've been at United for 15 years. I've run the education department, the community paramedicine department, and for the last few months I've taken over the operations department as well. So with that, our staffing, some of the changes that we've made is that we drastically changed what we're paying providers. That is what we needed to do to make those changes. Prior to my arrival, we were low in the staffing numbers. We definitely had some issues, even when I first came on board. I myself had to staff trucks. I still, from time to time, we can't control somebody getting sick. We can't control somebody having a loved one die or something like that. But having the appropriate staff does make a huge difference. As far as total providers, I gave you the numbers there. We have 55 providers. And to give you some idea of what that is for us, at the end of this month, we should have 5 more joining us. We'll have a total of 60 providers. That is more than what we've had in the past 5 years. So our numbers for staffing are going to be better than what we've had in a very, very long time. And we're kind of excited about that. Or I'm excited about that because it makes a big difference in overtime. It makes a big difference in a whole lot of things, right? And the numbers that you have there are only for our Lewiston. We still have providers out in Bridgeton. We still have EMS education staff. We have other administration. That number that you see there, the 55 total Lewiston, are just folks in Lewiston. So staffing, yes, we definitely had some staffing issues. Yes, we're still working through because it takes time to onboard people, right, to make those changes. We've hired a lot of people in the past few months, and those people getting trained and going through the training process and doing all those types of things, it takes time. But I am truly encouraged with some of the changes, and I'm excited to kind of see. A lot of people will talk about paramedics and paramedic levels and staffing and those types of things. One thing that we did do over the past few months, which you may or may not know, is we were licensed at the paramedic level, which meant that for emergency responses, we were required to send a paramedic. We have changed our licensure level to basic permitted to paramedic for some reasons. As we look at how we respond in the city of Lewiston and our responding communities, I think it's really important for us to send the correct ambulance and the correct staff. And yes, I truly believe EMS saves lives, but having the appropriate resources at the appropriate time is really important as we look at that. An EMT has life-saving medications. They can save a life as well, right? All levels of EMS are extremely important. And there are some things that we're not going to save the life. You think of a trauma patient. We tell all of our folks in school with trauma, what's going to truly fix that person? A surgeon, and a surgeon's nice. The EMS provider is going to safely transport them, keep them alive on the way there. But truly, when you think about some of these emergencies, they need an ambulance. They need to make sure that they're transported appropriately. They need the appropriate staff to do that. So that's our staffing bit. I wanted to make sure that, and kind of address that. I know that some questions, but EMS as an industry, we all struggle, right? We do have an education center. We do have the ability to train folks and move them through the process. But regardless, every EMS department across the nation are struggling with getting providers. We're just very happy with the trend so far that we have. As far as scope, I just wanted to make sure that to touch on the scope, which was in our bid, but basically what we've contracted or put into the bid process was that we provide a minimum of AEMT. That AEMT may be AEMT or paramedic, depending on staffing and how that looks. We've been toying, I have started to engage some of our shift leaders, some of our folks who kind of supervise, so to speak, or work with the crews, and we started talking about, you know, if we were to look at some other pieces, what it would look like and how we would do things. So we are working together to kind of see what that would look like. I'm excited to kind of think outside of the box with a few things with staffing and different types of scope. So we would make sure that there would be an AEMT present, but that's the piece there. As far as response plan, this is a newer response plan since we did change our licensure level. This is a response plan that basically, due to the contract, is kind of give you an idea. The various Echo, Delta, Charlie, Bravo, all those types of things, you know, that's the response code. When somebody calls 911, the dispatch center gives it a code. When they call us, our dispatchers receive that code, and whether or not it's an Echo, Delta, or Charlie, and then how we would respond to those pieces. In the data that I gave you, you can actually see how many Echo responses were for the town of Lisbon. You can see how many Delta and Charlie responses were for the town of Lisbon. So you have some of that data as well as you kind of go through that process. But to give you an idea, Charlie, one thing, big change that we've done in Lewiston that we started to do is as we code these responses, and with changing our licensure level, it's really enabled us to do that piece, is the Charlie level, you know, is very appropriate for AEMT most of the time. Now, it doesn't mean that you don't go to a stub tow and you get there and it's something else, and they have to call for another truck. They have to call for backup. This just gives us a window to say, okay, 911 has come in with that information. This is the best information we have. Let's send the most appropriate resource. Sometimes we go lights and sirens. Sometimes we don't go lights and sirens. All that is determined by the code. So that response plan there is for you to kind of give you a little bit more information, which wasn't necessarily provided in the bid. Another piece that a lot of folks have been talking about is location. Obviously, we don't have the town contract. I wouldn't necessarily rent a place or a facility right now if I didn't have a contract. I have discussed it. I have put stuff into my budget. I have looked at things. So if we were to get it, at some point, our plan would be to actually have a brick and mortar place here. Right now, it doesn't make much sense for us to do that if we're going through the bid process. Those things do take time, obviously, but the plan would be that I wouldn't just sit somebody in an ambulance for 24 hours. That would just be not something we're looking at doing. So that's one piece. The other piece with the response as well is that if we have our ambulance that would be stationed here, go out on a call, we would move other resources to that, which we'll talk about a little bit on the next one. Mutual aid. So some questions as far as surrounding towns. Mutual aid is something that I'm sure you're familiar with your fire department, with Lisbon, with United. We've all done mutual aid. The ambulance that's here in town, whether or not it's Lisbon, whether or not it's United, needs to be able to do mutual aid. Because at some point, the services are going to be overwhelmed in this town, in any town, and whoever needs to come and provide an ambulance. And I think that's really important. So that mutual aid really needs to continue regardless of who it is. You know, if things get really busy in the city of Lewiston and Lisbon is the closest truck, then we call Lisbon now. We call them today. We had a lot of different things going on. So that needs to continue. I have talked to Durham. I have talked to, obviously, United is willing to do that piece and send a truck back and forth. But Gardner and Topsom I have talked to, both of their chiefs, both of them would be fine with developing some mutual aid agreements and those types of things. As things were to progress, if it would be United, then I would work other mutual aid agreements out as well. Supply, I know that there was one topic about supplies and having to go to Lewiston to get supplies. When we have a brick and mortar here, we have a base out in Bridgeton. All the supplies go to Lewiston, and then we have par levels kept up at Bridgeton. They never run out of, not never, but they don't run out of supplies. They've never had a place where they didn't have what they needed on the ambulance. There's backup ambulances out there, but there's also par levels there. Same thing would happen if we were at a facility here, is that there would be par levels of equipment. So if they go do a call and they go to the mid-coast, drop people off at the hospital and come back, they can restock their truck. We've never set up a place that didn't have the adequate supply that they need. We would not expect a truck to go back to Lewiston and go out of the coverage area to do those pieces. Patient transport, Maine EMS has clear things as far as where the best places for folks to go. We would not force somebody to go to Central Maine or St. Mary's if they wanted to go to Mid-Coast. If we want them to go to the most appropriate hospital. There are times where somebody wants to go to a hospital that may not be the most appropriate, and we'll talk to them about that. Perhaps, you know, if it's a significant trauma or significant type of things. But if a patient truly wanted to go to the Mid-Coast, we would not allow that. Now, if they wanted to go to Boston from here, that's a little bit of a problem. But as far as if it's an appropriate transport, we would follow Maine EMS guidelines, Maine EMS protocol, and bring them to the appropriate facility. Sometimes some facilities you have to call med control and they say, no, we need you to bring them somewhere else. So sometimes even in the city of Lewiston, somebody wants to go to a certain facility and that facility may not have the services available or they may be too busy or something else happens, they may ask you to see if you could go somewhere else or talk to the patient. So even now, in certain places, certain hospitals are so busy at times, we have to communicate that with the patient. So hopefully that was a little bit helpful for you. I don't know if there's any other questions that you may have. Those are the ones that I wanted to make sure that I addressed because I know there were some questions there.
Are you done your presentation?
Yep.
Okay. I think our initial process was to let both of them go, and then we would have a period after that where we would ask questions. So if you're done, then was it an emergency? Go ahead.
I'm Amy McDonough. I'm the Deputy Chief of Lisbon Emergency. I'm just going to read off my speech now to save you guys time later during the town council meeting. I had many speeches and different variations written for tonight, but none of them seemed right. One was too long, one wasn't long enough, and one made me sound like a politician trying to win votes. I'm not a politician or a public speaker, but I am someone that cares deeply about this community. I have poured my heart and soul into the town of Lisbon and its residents since April of 2013. I've volunteered countless hours at Lisbon Emergency, and it wasn't so I could sit here today and boast about it. It's because I truly care about emergency medicine and providing the best patient care to the citizens of Lisbon. I think about it this way. If it was my dad or my grandparents, my brothers, my daughter, who all live in town, what kind of patient care would I want them to receive? This is why Lisbon Emergency has worked so hard over the last couple years to staff at the paramedic level. With the recent influx in applications, we have been staffing at the paramedic level in the high 90th percentile and as high as 100% this month. Lisbon Emergency has also been staffing a second truck during the days, and it is staffed at the paramedic level a majority of the time. This has made it possible to cover most second calls, even with our mutual aid partners relying on us more to cover their calls. My providers know the towns we serve. We know the police officers and the firefighters we go on calls with. We know that you can't take Borough Road in Lisbon to get to East Borough Road in Bowdoin unless you're on a four-wheeler. We know the route for the Moxie Road Race, and we know our patients and their families. Lisbon Emergency's Board of Directors has asked us over the past 5 years to staff at the paramedic level as much as possible, and we have done that. We listen to our board and what the towns want. Over the past year, we have gotten many new providers, but have also kept providers for many years as well. Sorry to point you out, Pat, but she has been a member since the 70s, when Lisbon Emergency was created. In addition, many of our providers have 10, 20, even 30 or more years experience. Providers are drawn to Lisbon Emergency for multiple reasons, but the biggest one is that we have created a culture of quality EMS for our patients and have created a respectful and supportive environment for our employees. My coworkers are my family, and this is why I'm fighting so hard. The Lisbon residents deserve these great providers, and they deserve the paramedic care in town without delay. I'm confident that if anyone in my family who lived in town called 911, they would be getting the highest level of care in the quickest amount of time. It really is as simple as that. United had multiple proposals to the town of Lisbon, but not one of them included having a paramedic staff truck in the town of Lisbon all the time. There's a reason Lisbon Emergency's proposal only has one option, and it's because we believe the citizens of Lisbon should have access to the highest level of pre-hospital care in town. I could stand up here and give the town council and the community proposals for an advanced level truck like United, which would be about $260,000, but it wouldn't be right in my mind. Why would I offer the citizens less than what they are already receiving? United has some great providers, and I'm not trying to discredit them in that respect, but the advanced level that United is proposing can only work to that certain level. On the top of the stack of papers I handed to each council member a few weeks ago is a chart that shows an outline of the difference between the advanced and the paramedic level. This ALS truck United is proposing is not a paramedic truck in town with an additional paramedic fly car. It is an advanced truck with a paramedic responding from Lewiston on a fly car. It also does not say in their proposal that this paramedic fly car is dedicated to Lisbon. United covers 90 square miles for EMS already. Who's to say this fly car isn't clearing a call in Minot or Mechanic Falls when help is needed in Lisbon? I'd like everyone in this room to hold their breath for the next 15 minutes. It seems unreasonable, right? That's how long it would take a paramedic fly car to get here to Town Hall from Russell Street in Lewiston. This is what you'd be asking the 6-year-old at the elementary school to do when they have an allergic reaction on the playground from a bee sting. This is what you'd be asking the 17-year-old with asthma playing soccer at the high school to do. And finally, this is what you'd be asking my family member to do when they go into sudden cardiac arrest and need to be intubated. You'd be asking your community members to wait 15 or more minutes for the highest level of care. This is not as simple as going with the lowest bidder for sidewalk paving or someone to work on the plumbing at Town Hall. This is life or death. This is a $59,000 savings to lower your pre-hospital level of care. Lisbon Emergency did not increase its bid proposal number of $334,000. It is the same as last year's. Lisbon Emergency has grown and evolved over the years from an all-volunteer service to where we are now, which I believe is one of the greatest EMS services in the state. But one thing has never changed. We have always been Lisbon Emergency. We sit on Main Street on Halloween and pass out candy. We follow the bus into town when our high schoolers win states. We are involved in so many ways besides providing emergency services to the town. Lisbon Emergency has proven over the last 50 years that we are dedicated to this town, that we are evolving, that we do care, and that we don't do it for the money. Lisbon Emergency has been exploring our options for the future. We're hoping to move towards becoming a quasi-municipal service if we win the bid. We have already spoken with the Chief of Medcare, a highly successful quasi-municipal service, and he stated there are many benefits for the towns in the service. We already have positive feedback from our board of directors and non-binding approval from our membership. We want to work with the town of Lisbon and Bowdoin and figure out a way that can make this work in the future that is beneficial for everyone. Last year, Lisbon EMS and Auburn Fire provided approximately 400 mutual aid calls to United service area. These numbers don't reflect the times United has used Poland, Turner, or even Buckfield as mutual aid as well. Another thing I would like the town council to consider is that it will not only affect the town of Lisbon, but also that of Bowdoin, who we contract with. It will affect the sporting events we cover, the rec department functions we cover, and various other contracts we provide service to. There will no longer be mutual aid for United from Lisbon Emergency. There will no longer be paramedic intercepts given to the town of Durham from Lisbon Emergency, or mutual aid given to Bowdenham. There are many unknowns with United's proposal. The second page I included in the packet you got 2 weeks ago is 2 pages worth of questions I would ask United before you go into an agreement with them. But some of the questions that stand out the most to me are, how long do you plan to cover Lisbon? Will you always have a paramedic fly car available? And is it also dedicated to Lisbon? Are you fully staffed to cover the towns and city you already serve? And lastly, who will you utilize for mutual aid to Lisbon if Lisbon Emergency no longer exists? I do support and respect the Council's right to explore their options for emergency medical coverage, but as someone who has family in town, approximately $5 a year difference in my taxes is worth it to me to have paramedic coverage and a dedicated, established service that has been committed to the town for 50 years. If chosen, I hope that Lisbon Emergency can continue providing the best care and working closely with the town of Lisbon.
Thank you. Is that all you have?
That's all I have.
Thank you very much. Any follow-up from either one of you? Okay. I think we'll move right into the questions. We'll have questions from the council, and then we can reach out for comments or questions from the audience. Anybody on the council wish to ask any questions?
If I may?
Go ahead.
Appreciate both of you coming in and giving information, because one thing, I've been on the council for a number of years, and one of the things that always comes up is the idea of the struggle with all our rescue services, right? Volunteerism is actually... Sorry. Can you hear now? That's better. Yeah, all right. One of the things that we've always had is a challenge. I mean, things have changed a lot from my dad served in the fire department for 19 years. You know, everybody is in town because they lived in town, and that's why they actually supported the town, right? It wasn't about money, it wasn't about anything but helping your neighbors, right? That's what it came down to. But things have changed a lot over the years. The idea of people to be able to volunteer and commit the time has actually changed. And just want to make a statement from my perspective as a town council. Our biggest concern is long term, right? You know, what do we need to do to actually have the service we provided? People don't just think they ought to have, but need at times, right? You know, I've had a circumstance where I've had a loved one sitting there unresponsive, and you know, after 10 minutes of waiting, then they call another department, and you know, putting a listening scanner, and after 5 minutes after that, realize that department's not coming, and then you know, having everybody trying to do the best they can, and 15, 20 minutes later, still trying to figure out, is it my best option to throw them in a car and go somewhere, right? And that's a rare situation, but I'm saying, you know, I've had that experience, so 5 minutes seems like 5 hours, right? So, and when a loved one's in need. So I think, as a council, I'm not speaking for the council, but as a council person, you know, anything that we do is actually looking at the best options we have, not just for today, but tomorrow, you know. I can be honest with you that since the last meeting, there are a lot of people that watch us on TV, through the being recorded, and there's probably a dozen more people who reached out that could not believe that Lisbon Emergency wasn't already a factor of Lisbon. I mean, most people think that with Lisbon on the door that it actually is a Lisbon department. That is just one of those things where, I mean, longtime residents called me and just said, I can't believe that you're thinking about getting rid of one of your departments, and it's really hard to actually go back and try to explain that difference a little bit as a contractor. Both your informations are really, really important, because I think we've sat in this room a few times and actually have had just kind of a, you know, the low point of discussions, right? We don't know where we're going to be tomorrow. We don't know where we're going. We just know that this whole service is, in general, as both of you mentioned, is in trying need, right? The lack of getting people, the lack of resources, the lack of getting reimbursed, the lack of just the idea of overall, it's been a challenge. So I appreciate you both coming in, because I think it's good information, and I think there's just things that we got to look at, right? And make sure that not just today and you know, if we make a decision tomorrow, that it's not just a decision that's going to be for the next few months or year, but how do we move forward with Lisbon and be able to not run into these circumstances down the road and next year or 3 years from now, and try to, again, everybody that pays taxes expects when they make that phone call for someone to be there before they hang up the phone, right? You know, that's not always the case on any of our services, but even with our fire, I think things are actually evolving over now. In the next few years, it's going to be more drastic. The idea of going from just a, you know, a volunteer firefight station where everybody shows up because they actually working in town to the idea of having full-time staff. I think that's just changes that just happening, and it's really out of our control. So, did listen to everything that was presented and looked at all the information. So I think there's a lot to be thought about, and hopefully, you know, whatever we do, we're going to try to make the best decision we can for the people in town. And you know, it's not easy for anything, right? You know, as a council, we got to make sure that we're not just doing it for today, but for long term. Not so much a question, but a statement. Just want you to know.
It's kind of a statement.
A lot of people actually reached out and said, you know, I'm surprised the council really didn't express their concerns or how they feel, and I think that sometimes it's one of those things where it's more, we're not just nodding and not doing anything. A lot of this does go into a lot of thought process, you know. Just one question that I had as we were thinking about it is the idea of, you did mention a little bit, United is the idea of actually the response to other communities. One of the biggest concerns we have is the idea of getting a call and not having an ambulance here in town to be able to respond to a call. And I realize that both services actually do have that need to go to other communities if needed, right? I know that a year or so ago we had actually asked about a second unit, and it was, you know, at that point in time way out of range as far as even you know, what cost effective that would be. But I guess that's kind of been modified a little bit, so there actually is a second unit now. I guess from United, I mean, if you were to have that unit stationed here in town and it was actually a response somewhere else, or if it had to go back to, I'd say, Lewiston or Sabattis, I assuming that would mean that there's all the units out that way are pretty much all used up, or
Right.
actually in service, or actually have a call.
Right.
At that point in time, we'd be waiting for another community to come back in, right?
Possibly.
Yeah.
Or something clears from the hospital and those types of things. That ebb and flow happens in all different communities, whether or not it's here or Lewiston or Auburn. Even within the city of Lewiston and the city of Auburn, ebb and flow is back and forth, you know. And sometimes all the different services, like I said, Lisbon came out today, I believe, and helped while we were busy doing other calls. So,
if we were to get, and I'm not sure if this information is readily available or not, but if we would actually have Durham respond to Lisbon, which I believe Durham does a fair amount, they go by the shop a fair amount. I don't know where they're going, but they're evidently coming out of Durham to go somewhere. Are they responding paramedic, or is that just strictly a EMT, or just more basic support? I know you probably can't answer for them, but typically they're probably not staffed with a paramedic during the day.
I'm unsure.
Yeah.
I think their chief is a paramedic, so I don't know.
Yeah.
It all depends on who they have working that day in our firm. Sometimes you're at the EMT level, sometimes at a paramedic. It all depends who they get to cover.
And Thompson, when they actually have a full-time service also, they typically staffed at that paramedic level all the time?
Chief, you want to come up to the mic so the folks at home can hear you?
Thank you.
Yeah, majority of the time, Topsom has a paramedic available on their primary truck. If their primary truck's tied up, then you won't necessarily get a paramedic. But it all depends on, again, their staffing for that day.
And the questions are just because what's second? What comes after the idea of our truck, what department or whatever service we have that actually goes out of our community, which, you know, both of them are. I mean, right now I believe that Lisbon Emergency is still contracted with Bowdoin, so we share that same primary paramedic level. And you said the second unit now is actually somewhat staffed by paramedic level also when possible.
Yeah.
Thank you.
Thank you. Mark?
I have a couple of questions for United. Now, in your contract, would that specify, would there be any kind of guarantee about what percentage of time there'd be a unit in Lisbon? I mean, I'm just concerned to be totally open-ended, would you say, would you guarantee 90% availability or some kind
That
of
all
level?
depends on the calls. So if a call comes in, it depends on how you look at that, right? So if we get an emergency call in Lisbon right now, and we transport that patient, that may not be anyone here, right?
Right, but I'm talking on average, or for a month, would you be some kind of guarantee so that we're not paying $250,000 to have you guys, not be here, you're here 20% of the
Plan
time?
is that the unit would be here.
I know, I
As
want
far
something
as
in writing in a contract, so I'm talking about
Well,
what you
the-
plan to be.
The contract, we'd have to look at that.
That's what I'm saying. Would you be willing to at least look into that, some kind of a
I'll be
guarantee?
willing to look at it, but of course, anything that goes and is solidified would have to be signed and approved by our board and our CEO. So I don't think that that's an unreasonable piece, but that would be something that we'd have to look at. And then if that's the case, then are you saying that you wouldn't want us to do mutual aid to other places? Because then a unit may not be here if Topsom calls for a unit, and we may not have a unit in town, we may have another unit coming here. So if you say we have to be here 90% of the time, that's fine, but then you're also saying that I can't, are we not participating in mutual aid? Does that make sense?
Yeah, it does. But my concern is I don't want to end up subsidizing Lewiston. You can understand that it's
I can 100%
4 or 5 times our size, and we
Yeah.
can't afford to be subsidizing Lewiston at the expense of people in Lisbon.
I definitely
That's really
hear
my
what you're
concern.
saying, yeah.
Anything else, Mark?
Think for a moment. If anybody else has questions.
I have a couple.
Sure.
Dennis, what is the retention rate of your new hires and turnover rate of your current staff?
I don't have those numbers. I could check on that.
Okay.
We have some long-standing staff. We have EMS itself is sometimes a very moving profession. A lot of the people who come to United come for a reason of volume, and they come to gain experience. So they're going on to medical school, so they're going on to be PAs, so they're going on to other places. So some people will come work for us for a few years and then leave because they have other aspirations as they come because they're looking for that experience and that volume. So as far as some of those numbers, I don't have off the top of my head. I wouldn't necessarily guess. We have people that have been there for extremely long period of time, and we have people that come and go after a couple of years, depending on what happens. And most of the time, it's a high volume service, especially in Lewiston. So it is something that can be challenging for providers.
So do you anticipate the 5 people you said you currently have in training will be increasing your overall size of your staffing, or so you don't anticipate any current have turnover that you are aware of that they're going to be filling?
Nobody's told me that they're leaving.
Okay.
So I would anticipate that. We also have three applicants that I'm interviewing next week that aren't even in that 5. So we have had some ebb and flow. But some people choose to move on. Some people leave because of family reasons, or they, or what have you. So I can't necessarily say that, but I don't have the retention rates. I'd be happy to supply them at some point. But
Cool. And Amy, what, just kind of ballpark, how often do you have 2 calls simultaneously?
It all depends on the day. Sometimes we can have 3 at once. Sometimes we don't get a call for 12 hours. It all depends on the day, how the weather is, what ways the wind is blowing.
The
But-
moon,
Is it a fairly common?
full moon?
I would say probably 15 times a month.
Okay. Thank you.
Mark? Go ahead.
Okay. My understanding is with United, this would be a 1-year contract. Is that correct?
that all depends on the negotiation. We never
Okay.
said whether or not it'd be only a 1 year.
Okay.
It's something that had to be negotiated.
Okay, because it's just a concern I have going forward that if we accept United's offer, then basically Lisbon Emergency is pretty much out of business, and then you guys can come back to us next year and say we want to, $500,000, and we don't really have any other option because they're gone. So it's a real concern to me.
Both, but that is a concern. Our goal is not to affect the Lisbon Emergency. So really, that is a possibility. But at the same time, any EMS service that does that, even in their proposal, they said they would only hold it for a year. So it's both, it is an interesting time. We've serviced our communities for a long time that we do have. We've been in Spatus for a very long time. We've been in Lewiston for a very long time. So we've serviced our communities. We've been very fair to our communities. Obviously, we have challenges. Bridgeton, we've been out there for quite some time, dealing with smaller, more rural communities out there, and I think we've been very fair and worked with them as well.
Just have one more question.
Sure.
Staff of Lisbon and Bridgeton now, and this was asked me the other day after the comments about local people. What's the percentage, how many people that you actually have employed now that actually are Lisbon residents? Could you give me any kind of rough idea? It doesn't need to be exact.
I believe we have 6 on our roster that live in town, 2 paramedics, 2 advanced, and 2 basics.
What's your total staff that you have now?
32.
32.
6 out of 32.
Thank you.
Is one of the paramedics the chief?
No, it is not.
Yeah. I got a question for Dennis. This is really good information. I was really surprised to see the lack of volume. I would have thought there would have been more volume of people at high risk than there really is. I mean, this is really good information for sure. Does United have issues getting audited? Do you guys get audited for your books yearly?
Yes.
So yearly, you have no issue getting an auditor in there?
We have auditors that come in every single year. They come in for about a week. They go through everything. Everything is financially audited and that type of stuff. Yes.
Would that be available for us to see?
That was my follow-up question.
I'm sure that can be negotiated as far as those types of things. Yeah.
I mean, it's a concern, right? I mean, the town taxpayers, spending that kind of money. It would be nice to be able to show them that it's being used properly, and and the only way you can do that is an independent audit, right?
Yeah, we have independent auditors that come in and do all those pieces. We are not for profit, so all of those pieces are in place.
Yeah. Another follow-up on what Fern said. Obviously, we all have residents that come to us, call us, text us, and all that. And like I explained to them, yeah, it's not like bidding on a sidewalk, but that's what we do, right? We put out contracts for bid here at Lisbon. That's what we do. And what we don't do is we put them out for a reason, and everyone follows the bid process, and then we get recommendations on the bids. Yes, Lisbon Emergency was higher, and I heard what you said, it's $5 more a year. I get all that. But we are still required to be fair on the bidding process. So it's not we don't want to send the impression that, that Lisbon is a guaranteed check every year because we're worried about what we're talking about. The bidding process is there for a reason. And, so we got to be also careful with that. We don't want to be known as in that manner when we're accepting bids that we're not looking at them for the reasons why we send out bids, right? So I just want to make sure that is said, because there's quite a few people that talk to me about that, and then once I explained to them about the process, they understood, right? So just want to make sure that was clear.
I just have a staffing question for both. Are you both at your target staff levels, or so you mentioned you have 60 providers, but are you looking toward a number based on your shortages? Because obviously,
Based on where we're at, if we were to take over the town of Lisbon, I would continue hiring full time. At this projection, probably I would be at the point where I'm looking at slowing down how many full time folks I'm doing. So right now, with this next 5 that comes in, depends on whether or not I continue to hire full-timers.
right, I imagine the increased revenue would give you the ability to hire more staff, but I guess, is there a target, EMS is obviously not my field of expertise, but I was just curious if you have a target staff level for both, or if you're adequately staffed. And
We're close to it at this point, but it all would depend on this piece here. Obviously, we're also worked with Bridgeton as well, and Bridgeton is unique because of the because it's rural. It's hard to get providers out there, so there's always some challenges there.
And I guess as a follow-up, of the new hires, the folks that you're training, and again, not knowing anything about licensure and stuff, are they on the road responding to calls, or are they sidelined until they get licensed or certified? So,
They're
like,
all
of the 5 new hires,
They're all
okay.
licensed as EMS providers.
So, like, of the 5 new hires, they're not in a classroom for the next 300 hours before they'd actually be
They're all
responding to
providers,
calls.
although they'll be on the road precepting, so they'll ride. Pretty much every EMS service has somebody ride as a third, and then they work with a more experienced provider as they go through that process. So we have FTOs that will work with providers. But those 5 that I mentioned are all licensed at this time.
Gotcha.
I have a follow-up, Dennis, would you, because I'm really intrigued by this information here. How do I know which one is Echo, Delta, and Charlie, as far as?
So if you look at, for the Town of Lisbon report, that says Town of Lisbon 2022, if
Yeah.
you flip to page, should be in there somewhere. I'm not sure if that one went in, although if you look at the numbers for you, let me just double check this one here.
I don't want to cut in front. There is a page in here on page 8 that shows the levels.
It should be page 9.
Page 9.
And there,
Okay,
page
yeah,
9
got
shows
it.
Alpha, Bravo, Charlie, Echo, Delta, all those were there, and it tells you how many calls in the zip code you were responded to.
Thank you, appreciate that.
The other piece, as you look through in EMS as well, it's also important, regardless of where you're at. 911 calls result in either transport to the hospital, non-transport, canceled en route. So for all those different pieces, there are reports as far as how many cancellations and how many transports and how many things like that. So transport is that somebody actually went to the hospital. Non-transport is that they didn't go to the hospital. But the Echo, Delta, Charlie, all those types of things are in there as well.
Excellent, thank you. Question for Lisbon. In the last couple of years since I've been elected, we've been asking, when are you going to have an audit done for Lisbon? And the answer was always, we can't line one up, everyone's too busy. So can you even get one on a calendar, a date on a calendar? I mean, I don't accept the answer that we can't get anybody.
Yeah, I can answer that. John Courts.
Excuse me, can you please come to the podium and wait for the chair to approve? Thank you.
Go ahead, John.
John Courts. I'm the financial captain of Lisbon Emergency. We have, in the first 3 years, we didn't have enough money in our budget, and our board is made up of counselors, 2 representatives from the town of Lisbon and 1 from the town of Bowdoin. They did not approve a audit. We've always made what we had been doing is giving the finance director of Lisbon open access to all our books, and they were auditing them, self-auditing. We put it in the budget this past year, and we couldn't find anybody. We actually tried the town of Lisbon's auditor. We weren't able to get one. The chief did line up before he went out sick, did line one up for the fall. So we do have somebody lined up for the fall to do it. That's the earliest we could find. We started last September.
So when you say fall, is that October, November?
That's what they're telling us, fall. That we can't get them to commit to a time.
So there's no commitment?
He's committed to do it in the fall is all he'll tell us. He's saying September, October is the time frame he's giving us. And again, it's not like we're not trying. We even went to Kayla, the past finance director for Lisbon, trying to help us because she was on our board to get one.
Okay, thank you.
Don?
Well, I've been trying to think if I'm intelligent enough to ask a question, but
Give it a shot.
one of the things I know is that if you're in business, you schedule people to work however many hours you schedule in a week. And I'm just curious how that equates to both Elizabeth Emergency and how it would equate with United. How many hours would, I know how many people you have. I don't know whether they're full-time or part-time. But how many hours would you ideally, or are you able to schedule for our town?
So right now, all of our employees are per diem employees. Starting July 1st, we're hopefully hiring 3 paramedics full-time, so they'd be scheduled at 36 hours a week. We're going to continue staffing 1 truck 24/7 at the paramedic level, and when we have those excess of people that are per diem signing up for shifts, we'll staff the 2nd truck.
So how many shifts are there? 8-hour shifts, I assume.
We do 12, 24, or 36-hour shifts.
Okay.
So it's kind of hard to equate how many shifts there would be in a week.
Okay.
Same challenges.
Yeah.
Same challenges. Especially when you have per diem, right? So per diem are full timers, right? So if you look at full time, I can give you those numbers if you want, but full timers, we do 24/16. They do 24-hour shifts, and then they do a couple days off, and then they rotate and do a 16-hour shift. Then we have per diems that will come and work, and they'll do 24s, they'll do 8s, they fill in the schedule and different things like that. So EMS, a whole lot of different things. For us, we're looking at 1 truck, 24 hours a day that would be here, or a dedicated truck to move into the city or town. My thought, talking with some of our shift leaders and those types of things, we've actually been playing around with as we look at changing our schedule to be more proactive with more of a tiered response. We're actually looking at, would it make sense to, with our 24-hour truck, actually have them come over here for 8 hours, because it gets them out of some of the multiple calls and in-town transfers and different things like that. So rotating a truck here to keep people fresh and allow them to get through a 24 even easier. I've been exploring some of that with some of our shift leaders to kind of really talk about, what would that look like, and is that something that's, instead of coming over here for 24 hours, would it make sense to move somebody over for a few hours? They get a little bit of a respite just because. Now, they could get 3 calls at a time, right? It's EMS, and it is something that is really hard to plan for. So, they could be busy, but statistically, as you look at the numbers and how many calls you do in a year and year to year, what it looks like, there are averages that sometimes some people get good averages and sometimes people don't. So that's, I don't know if that even answers your question, but.
I don't know either, but that's.
I just have a follow-up in 2-part question. Just for clarification, is United, is labor organized at United, and do you have a contract, or is it in negotiations?
It's in negotiations.
Okay, so when you talk about schedule changes and without knowing, would that be something that's subject to collective bargaining, or do you have management rights to kind of unilaterally
We're
just
in
dictate
negotiations
schedules?
right now, so we're working with the union on that piece. And we work with our legal counsel on all those things. There is no contract. We're in contract negotiations right now. So part of our management rights, it would be in there, but there's no contract at this time.
Gotcha. I just know, like, even
Just
with my
started
public
since
works, I can't just unilaterally change their schedule without negotiating in good faith. So I just wasn't sure if that was part of negotiations or part of something you had secured through management rights. Thanks, Dennis.
Question, if I could.
Sure.
What did I say? So, mentioned today that Lisbon actually responded to Lewiston in a sense for United as a backup.
For the microphone.
So I was listening on the live feed, couldn't hear you at all. Move my laptop so it gets closer. Is that better? I'm not sure if it's even on. It's actually not even on. That's unusual, because usually I can speak too loud, right? I'll share Mark's. With the call today, I mean, if you actually did call for extra help, and I know Lisbon actually is a growing community, which I assume Lewiston is, and Lewiston, Auburn, and all the surrounding areas are growing just as much. Do you see your need for calling people in as just kind of a lack of staff, or actually the excess of calls? Because, I mean, you typically staff for what you would see you need for typical average calls, right? You pretty much have the numbers of what you, over the course of a year, what you do for calls and averages. I mean, it's just one of those things. I was just wondering if some of the things that we're seeing as far as for, units going into different communities is the idea of the communities not really gearing up for their staff and the number of calls they're having. And the same for Lisbon. I mean, we're not getting smaller. I mean, last year we grew by almost 400 people, which doesn't seem like a lot, but that's still 400 more possibilities for calls, right? So I'm just kind of curious with any department. I mean, is there expansion and some of the people you're bringing on? Is the idea of just, I guess, do you feel you're adequately staffed for the community you live? I mean,
right now, we're working on that piece, right? So we've hired a bunch of people over the last couple of months. We still have multiple people in orientation phase and process that are going to be going into a full-time schedule. Those 5 new people that are going to start are also going to be going into, not all of them are full-time. I believe 2 of them are full-time, and the other are going to be per diem. So those 2 full-timers will go into that schedule. So the holes that we had today will be filled in the next month. So yes, I believe that within the next few months we'll be adequately staffed, and doing this would not hurt what we're doing. As far as today as well, I don't know, but the other piece is that, if Auburn gets busy, we help out Auburn, and if we're out helping Auburn or we're doing those types of things. Today was one of the days that there was a lot of emergency calls in Lewiston, and I had 4 trucks on, and they were all busy doing that, and we had out-of-town transfers that have been waiting, and we'll have to wait because just the city was very steady today.
busy day. The moon was
Busy
right.
day.
With the 60, say if you do get to that 60 number that you're looking at, potentially with the 5 more or more coming on, now would that mean you would actually have more trucks in service, or is that the idea you just have more people to rotate through your
More
rotation?
people to rotate through, maybe a little bit less overtime.
So it wouldn't put another truck on. I mean, at this point, it wouldn't put another truck on even if you got to that 60 people. It would be more the idea of just the idea of having more staff to actually to staff the trucks you have, pretty much, right? Okay. I was just curious. I mean, as time grows, I mean, I listen to Lisbon, and their call volume doesn't go down at all, and seems to be increasing all the time. So I'm just wondering if we're actually proactively looking at how those changes are and how we can adapt.
If we had the call volume change, we do have not a 24-hour truck that we could move to 24 hours that we staff. We staff a daytime truck that, if that's the case, we actually are looking, like Sundays for me, there are certain days that we are overstaffed, and then as soon as I start really looking at it, we're not, because we get a day that's a really, really busy day. So it's a really tough thing to do and to figure out, and for some odd reason, first 2 Saturdays of the month for the last 3 months have been extremely busy for 911 calls in the city of Lewiston, and the last 2 Saturdays are extremely slow. I can't explain it. I just look at it, right? And then you try to do the best you can with what's going on. And then, is that mutual aid because somebody else got busy? Those are all things that we try to look at the data. We can do the best we can, but we can't predict if somebody doesn't feel well that day and then call for an ambulance.
And you mentioned something earlier that I hadn't heard before. So mutual aid, sometimes there is actually just mutual aid where you're expected, right? And there's actually contracted mutual aid. I guess you had mentioned the idea of contracts for mutual aid or agreements.
Agreements.
Okay.
So most of our Lisbon, most other places, we have agreements saying that, if we call, they'll come.
Yeah.
And the same thing vice versa. So most ambulance services have mutual aid agreements, I believe. I'm pretty sure fire typically has things as well.
Yeah. And so those aren't really contracted, those are just more agreements.
Mutual aid agreements.
Yep.
They're just, if we have services available, we'll help out. Same thing with Auburn, and at times they don't have anything available. So then you go a little bit further out.
So as far as for Lisbon, I mean, right now, you're actually contracted, so to speak, with Lisbon and Bowden, right? I mean, those are the two, like, actual contracts. Now, are you committed to any other communities right now for as far as mutual aid or supporting staff members at all at this point or in the future? Or?
We do mutual aid for Bodenham, United's coverage area, of course, and then Durham, and every once in a blue moon we'll go to Auburn.
Now, the mutual aid, is that actually staffing a unit, or is that actually running one of your units, one of the two that you have, the Bodenham?
Running one of the two that we have, yeah.
The Bodenham?
Yeah.
Okay, thank you.
And most mutual aid, we don't staff per se or do that piece. It's that whatever we have for available units, do we have something available to send?
Yeah, you only can send it if you have it, right?
Correct. And sometimes the city of Auburn and other places, sometimes certain communities will hold a truck just because that's the only emergency truck for various amount of towns. So we may not have one to send 3 or 4 towns over. Sometimes we do, but it all depends.
Thank you.
I got one more, Dennis. How your assets, so your vehicles, what kind of shape are you in? Do you guys get a new one every couple of years, or?
We have been working through remounts and working through that process. So each year we've been sending them out, remounting, bringing them through. We have 3 backline ambulances, so if something breaks down and the mechanics are working on it, we have those. We also have a couple of backline ambulances out in Bridgeton, so if we had to. And we also have one that's not stocked elsewhere as well. So we have multiple units. Let's just say 911 response is not kind to vehicles, regardless of where you work. So things break, for sure. Our mechanics do a great job. I'm sure any mechanic that works on ambulances have appreciation, and they're magicians sometimes, regardless if they're here in town or Portland or wherever they're at. Some of those folks do amazing things to keep things moving. But as far as that, yeah, we have one remount that will be coming in this. So we try to do at least one remount a year and bring that through. And then when the remounting is done, then we'll be looking at bringing in assets. But we do have because of the size of our fleet, we do rotate in quite often.
Oh, so it sounds like if one does go down, you do have another one to
We have
get back
three
in.
back lines right now
yeah.
in Lewiston that are operational. I don't know that anything's up on the lift right now, so I think we have 3 backup ambulances right now that we could hop into if we had to. We also have 2 out in Bridgeton that are fully stocked and ready to go.
Thank you.
And one final, if I could.
Go ahead.
So I'm not going to mean to crowd space here. So the contracted number that we have, so with either service, if we were to ask for extra activities, meaning the idea of being stationed at Moxie or a football game or the road race, those are all just considered as part of the contract as far as for services, or would there be extra charges for extra duties, I should say, from either one?
So right now, how are we utilizing the existing crew, or are you expecting us to send an additional unit over?
I guess that would be really up to, not so to speak. I got to be honest with you. I mean, if either one was actually covering Moxie, and we have 30,000 unusual people in town, not unusual, but people that not could be unusual too at times. Not the usual people in town. I mean, it would be really hard to think that we would just have one unit in town to actually accommodate. So I mean, it may actually be the idea of staffing for the event. I mean, same thing with Lawson. I would assume that when they have a big event, you have actually all hands on deck, right?
We add an extra crew.
Yeah.
We do hire in extra trucks.
So again, it's just one of those things as we go through the year. It'd just be nice to know if what would we look at. We know we have events that are actually already scheduled. The community does have an opportunity where we are looking at doing events in town that could bring in thousands of people over the course of a summer. We're just curious on what that would look like, and is there what type of charges that would be if there was an additional unit? Is that actually is there set prices, or what we would need to do just as forward thinking? Maybe you can't answer it, I don't know, but it's just worth a question of what what you think.
So if you have a large influx of people and we're looking at those pieces, that would be something that we'd have to finalize in the contract.
I was just wondering if the events are funding those things. I don't know.
Typically, some events in Lewiston, like I had a request for a 5K, that's a private event. They would be expected to fund it on their own. There are some public events that we do cover, and we don't necessarily charge the city in those types of things.
I guess the question would be more, I'm not sure if there's any historic people in town that maybe the chief would know. Do we actually pay right now for extra coverage for any of the events for Lisbon emergency at this point, or?
That would be a question I would throw out to Mark Stevens, reference Moxie and how that handles this. I don't know the answer to that one.
I've never seen it on the budget line, but.
John might, John, I'll recognize you if you have an answer for that.
So what we've always done with Moxie is we've charged the Moxie Festival for coverage. We obviously have to plan like we're going to be in business July 1st. We've already started a plan where we're going to put on 3 trucks for Moxie. That's our goal. We had a membership meeting this past weekend, and we already told everybody plan for July 8th. As far as the schools, we're contracted with the school. We do sports coverage. We do all the football, softball. I mean, that's mostly people in town that are covering that, or people getting off a shift.
So those actually, so you said that you're contracted, so is there actually a charge for that?
There is.
And then that's not your primary unit, that'd be a secondary unit?
It's a secondary, it's one provider showing up at the school, and we charge the school for that. And it's minimal, and 90% of what we charge goes to that provider for paying them to show up. So all the sports games, hockey, everything that's in town that gets played. For football, we put an ambulance at the football field. Again, that's contracted through the school. As far as putting a ambulance dedicated, we have to plan for that, and we have to charge for that because it's not in our budget. However, things like the Halloween, I'm not going to be correct in all the things that go around town, but like when they did Trick or Treat, we stationed our on-duty crew down there. When there's stuff going in town, we make sure we have a crew on. We also talk about it. We also try to get another crew staffed if we can.
Now, if you don't mind, the Moxie is pretty much, it comes all out of the same checkbook as ours, right? But if you were to put 3 units on, one would be already the existing unit, there'd be 2 extras. Any idea rough what that would cost for the day?
We already sent the contract to the Moxie, and I can't break it down on my budget because Jim usually takes care of that. I want to say, and don't hold me to it, I want to say it was $3,600.
That was for 1 extra unit or 2?
That was for 1 extra unit plus but we're looking at putting on 2, just because we think this year it's going to be bigger than normal. And we have other commitments going on as far as our mutual aid partners are busier, so we feel the need that we should probably put on more staff that day. It's July 8th. If it's a hot day, it could be a lot of transports.
And it actually could be a multi-day, like 4 days this year.
I've only done it once, and it was 89 degrees, and we ran all day.
Thank you.
Okay, I'm going to close it out as far as the council goes so we can move on. I'll get to you, Ryan. I have the benefit of having been working with Lisbon Emergency since I started here in the fall of 1978 as a law enforcement officer. 40 years. And Pat Tardif was a young lady back then. That was my best Joe Biden right there. I've worked hundreds of calls with Lisbon Emergency as a law enforcement officer with Pat, with Mike, and we've been on a lot of really, really tough calls, and I love these people. I really do. I've seen the good, the bad, and the ugly with Lisbon Emergency over those years. I like how they've come around and developed their service now. Also back in the day, United was the gold standard. United was who I think, who paramedics wanted to go work for. They wanted to go to United. So we all know that it's a fluid, Lisbon, United, the EMS services are fluid, just like law enforcement. You never know what you're going to get. You never know what's going to happen. You're going to run out of people. You're going to run out of units. You're going to run, depending on what the call is. So we have to consider that fluidity, and we just got to try to put our finger on who's going to be the best one to manage that fluidity when it happens. That's the way I look at it. I have some questions here. Some of them have been answered, some of them haven't. That's fine, and I'm going to use the rest of the time for Ryan. I know you have something you want to say, and then we'll open it up for anybody in the audience.
As the town manager can attest to, I'm pretty short-winded, not long-winded. But it's best just to put my stuff on paper because it'll be easier for Lisa afterwards.
Thank you.
But real quick, since I was one of the people that sat on the committee that reviewed the bids, I think it's pertinent that I speak to some of the things that I graded, and then some of the information that was learned afterwards. So, good evening. My name is Ryan McGee, and I'm the Chief of Police here in Lisbon. It is great to see a large turnout this evening and also at the last council meeting. I want to first start off by explaining that I reviewed both of the bids for EMS coverage for Lisbon multiple times and was able to score them accordingly using the matrix provided. I'd like to thank both agencies for submitting the bids, and I appreciate the information in them. The information is important to me as my main focus is the public safety for the Lisbon community. I've left out personal biases and opinions when scoring the bids on the matrix provided to me and rated the two ambulance services directly off what was written in the bids, because I too have worked with Lisbon Emergency for 22 years on difficult calls, so it's the chair. I want to point out several different items that were scored. One was that of service quality, and Lisbon EMS and United Ambulance were both given the highest score due to the services they provided to their communities and the matrix we were provided. Price, there was a lower cost with United compared to Lisbon. However, in an emergency situation when an ambulance is needed, there is no price tag on the well-being of your child, your spouse, mother, father, or loved ones. However, there is a scoring matrix that includes cost and was scored accordingly on the matrix. Another scoring item on the matrix was experience and expertise. As I said, I have firsthand knowledge of the experience working alongside Lisbon EMS for the past almost 22 years. This past year, I've seen an increase in expertise and personnel at Lisbon EMS. I've not had a lot of working knowledge of United. However, their bid speaks to some of their expertise, and both EMS services were given the same maximum score in the scoring matrix. Capacity and compliance. This is one that I referred to a lot to the bids on the factual evidence that were written out by both providers at the time I reviewed both bids. On page 1 of the Lisbon Emergency bid, it spells out the following. From Lisbon Emergency's base of operations, we will staff the primary ambulance with, I believe they meant to say 1, ALS, parentheses, A-EMT or paramedic, provider licensed by Maine EMS. The second provider will be licensed by Maine EMS. The primary ambulance will be staffed 24 hours a day, 7 days a week, 365 days per year. And Lisbon Emergency will sign mutual agreements with other area EMS services, which will include paramedic backup if needed. I point that out. There was a question today, but they said they would have signed mutual agreements. Under Section 2.1, operating staff of the emergency medical services for Lisbon and Bowdoin, it states the following. Starting in December of 2022, we started staffing a 12-hour truck during the day. The ambulance is staffed up to the paramedic level and allows Lisbon Emergency to respond to second calls for 911 service as well as perform transfers. If transfers are performed, it is only by one ambulance at a time, so there is an ambulance available for 911 calls. I want to take a moment and point this out, since in the past I've expressed concern of having only one ambulance available in Lisbon. Now, Lisbon EMS is starting a second ambulance available to respond to calls in Lisbon when an emergency occurs, if not doing a transfer. Lisbon EMS has taken steps in the past 5 months that I have seen to start having the second truck available during the day, which I commend Lisbon EMS for doing this. I will add this is excellent, but I would like to see a second truck available around the clock. I know I've been told before this is too costly, but again, cost cannot play the ultimate factor in our community safety. In reviewing the United Ambulance bid, on page 4 under scope, United advises the following. United Ambulance Services will provide one ambulance 24 hours a day, 7 days a week, with staff of two to provide advanced life support and basic life support. The ambulance and staff will be designated to the town. When the ambulance is requested for service, other ambulances will move to cover the town until the designated unit returns. The ambulance will be rotated within the town limits as necessary. Initially, response times may vary due to location of the unit. The unit will be expected to stage in a mutually agreed upon location until a base established with the town. A couple of paragraphs further down, United Ambulance states, in the event of an emergency exceeding the level or scope of these providers responding, a paramedic fly car or unit will be sent to assist the providers as needed. If the nature of the call is coded to trigger a paramedic response, one will be activated while the dedicated truck is en route. So I bring this up as United is proposing a truck stationed in Lisbon, and if the primary Lisbon truck has a call, they're stating they will backfill that truck with a second truck until the primary truck returns to town. They also point out that they will have a paramedic fly car response if the call warrants. Having a second truck available to backfill around the clock is a benefit to the town of Lisbon and something I want to see. Because if a truck is tied up in Bowdoin and a call comes in Lisbon, it would be great to have a truck free in Lisbon to handle the call for our community. Since reviewing the bids, I was also at the last council meeting, and I listened to the council meeting of a husband that took the time at the meeting and read a letter from his wife, who is an ER nurse at Maycross Hospital, as all of you did. In that, I had a strong takeaway from the letter, and would have to agree that a paramedic fly car coming from out of town is not as beneficial to Lisbon if we have a paramedic that is already here in our community. Since reviewing the bids and submitting them last month, I've been contacted by professionals that are not only friends, people who I trust and respect in the area that include EMS, fire, and police professionals. I've been told that United is putting forth a strong proposal of having an ambulance in town and having a second ambulance to backfill. However, currently there are staffing concerns within United's department, which they are working to build on, which I respect. These are all things that I've been told, and tonight both agencies have spoke to it as well. However, I was also currently told Auburn Fire and Rescue is constantly handling calls for United, and Lisbon University is also covering calls for United due to them not being able to handle the call volume. These are all issues that raise concern to me since reviewing the bids, as I do not want Lisbon residents having to wait for EMS coverage, and I can speak from experience that there is no worse feeling than being on a serious medical call and doing CPR or life-saving measures, waiting for an ambulance to arrive. In the past couple of weeks, I've personally been first on scene to 2 serious medical calls, and I started and performed CPR on people in our community. One of the 2 people I did CPR on unfortunately passed away. I want to point out that Lisbon EMS had an excellent response to both these calls that I was on. They were professional, compassionate to the victim and their families, as I've seen United do on calls as well. Lisbon EMS has been growing and becoming more formidable. They may be more expensive, but we get what we pay for, and public safety is always going to cost money in order to keep people safe. So, some people have heard this before, but it's important to hear. Because there's people in this audience that haven't heard this before, and I can't stress it enough. Lisbon's a growing community, and according to the 2020 census, we are currently at 9,711 residents. In the state of Maine, there are over 494 municipalities. Portland, being number 1, is the largest. However, Lisbon is the 23rd largest community in the state of Maine out of those 494 plus communities. Anybody here can look up the 2020 census and get those stats for yourself. You'll see that the number 24 town is incorrect, and we're 9,711. So we'll continue to grow. I'm almost done, I promise. We'll continue to grow with several more neighborhoods going in this year in gross development alone. Lisbon is now larger, and I want everybody to listen to this. Lisbon is now larger in population than Topsom, Yarmouth, Freeport, Bath, Cumberland, Brewer, Cape Elizabeth, just to name a few. And what do all these smaller area towns have in common with Lisbon? Well, these towns have their own dedicated ambulance that is a town department. I believe I fairly and ethically reviewed the bids that were given to us and fairly scored them on the scoring matrix. Since that day, I've listened carefully to the professionals in the area about status of EMS. I've listened tonight as well. I believe both United Ambulance and Lisbon Emergency are excellent services that anyone would be fortunate to have. I believe the appropriate conclusion that I've come to on staffing and coverage for our community is that the town of Lisbon should contract with Lisbon EMS. Thank you.
Thank you. I have two questions before we open it up. Dennis, can you explain Lisbon Emergency's $334,000 bid? Can you tell us why it's $334,000?
I didn't do the bid. I wouldn't guess to say why. I mean,
What's your
probably
gut?
It's the
What's your
same
gut?
as what the Blue Ribbon Commission was.
What's your gut telling you
What do you mean?
about why they're at 334?
Because they have infrastructure. Because this one community and having Lisbon Emergency here, they have a deputy chief, they have insurance, they have audit, they have all those types of things. So that one service, this town is supporting that one service. When you have multiple communities with the same administration, the same things, you have an opportunity to make things a little bit less.
Amy, can you explain United's $260,000 bid?
I cannot at this time. I believe that their bid is lower than ours because of the service level. An advanced level provider is cheaper to staff than a paramedic, and we're staffing at the paramedic level. So I assume that that's why it's lower than ours.
And you mentioned in your statement that you could actually provide service for the town at 260 at the same level, the same as United?
At the advanced level, correct. But we didn't put that as an option because we didn't really feel like that was right to offer something lower than what we've already been
Yeah,
doing.
I'm not questioning whether it's right or not. I'm just trying to get a handle on it.
Yeah.
Okay, thank you. Thank you.
You're welcome.
If there's nothing else from the council or any honored guests, Nate, then, oh, Nate does have something. Okay. Quickly.
Just to, quickly, I didn't write a long speech out like the police chief did.
So that means you're unprepared, is what that means?
No, it means I'm not going to sit here and read a speech.
Okay.
But, you know, like the chief said, we did sit down and we reviewed the bids based off the RFP in an objective manner. And a lot being taken into making a decision beyond the objective. There's no doubts in anybody's mind that both services have pros and both have cons. The one thing that concerns me, and I know that Dennis has mentioned a lot of this already, is the staffing that's happening at United. And it's not unique to United. It's a problem across the EMS system in whole, and I totally understand that. But right now we're at a situation where we have to supply coverage to our community. And do we go with what we know or go with something we don't know? And with that being said, I would recommend that we go with what we know. Thank you.
Thanks.
Can I ask one more question?
Sure.
I know you want to. It just kind of trying to put my head around it. So a year or so ago, myself and the chair with Mike, would you please? Yeah. Sorry about that. I'm not used to having a mic. So a year or so ago, we actually, myself and the chair actually had a meeting that was actually with the boards, and we were talking about possibly at that point in time the options of a second unit. And at that point in time, it was actually brought to us that it would be well over $500,000 to the community for that second unit. Just kind of curious on, you know, is there $500,000 more in the budget now that actually, or half that, 200-something thousand extra to actually bring on that second unit? Just trying to get my hands around what's actually changed over the last couple. I know the price of personnel hasn't gone down and the price of equipment hasn't gone down. I'm just curious of what actually allowed us to actually get second units and just, yeah, I know at that time we were really hoping to actually, you know, see a second unit, but the cost is just prohibitive. So I was just curious what might have changed.
So last year we got an influx in applications, like I said. Prior to that, we didn't have enough staffing to staff that second truck. And we subsidize that truck with transfers that we do. We do a lot of transfers out of Midcoast to like local nursing homes and things like that, which are high-paying calls that pay our payroll and wear and tear on the trucks, and that's why we're able to do the second truck during the day.
But that second truck is also still doing those transfers and stuff to actually try to recoup the costs, correct?
Correct.
Sorry, Chair.
Okay. I'm going to read the bottom line of the agenda down here. It says, public comment is not typically allowed during council workshops. There may be occasions where public comment may be recruited, but normally workshops are reserved for council members to discuss and educate themselves on a variety of issues facing the town. Prior to conclusion of the workshop, if time permits, the chair may allow questions from the public. At that time, anyone wishing to address the council will wait to be recognized by the chair before beginning any remarks. Audience members will move to the lectern to address council and shall provide their name and address prior to addressing the council. I'm going to allow some comments from the public. So whoever wants to step up, Mike.
I'll put the mic down. Good evening, Council Chair and the Town Council. My name is Mike Robitel. I live in the town of Lisbon, 17 Charity Street. I've been a resident since 1972. I'm a career fire chief and a paramedic in the 28th largest community, chief. Sorry. Whatever. I don't know. I'm going to go. Anyways, I consider myself a subject matter expert as a fire chief and an EMS chief who delivers emergency medical services and fire services to a community very similar to Lisbon. I've read the RFP and the recommendations submitted by the town manager regarding medical services in Lisbon. I find that this recommendation is absolutely not the best service delivery to the resident of Lisbon. First, United Ambulance has proposed their best services, which are less than the current services that we, the residents of Lisbon, are receiving. An advanced ambulance with a paramedic fly car puts a paramedic in your town 0% of the time. Lisbon Ambulance currently provides this high level of service 93% of the time. Waiting a paramedic 15 to 20 minutes is never good and could potentially lead to devastating outcomes. A paramedic fly car is offered in United's best bid, as they will not be staffing a paramedic in our town. Again, Lisbon Ambulance will be. The savings of $59,000, we've been talking about $59,000, will equate to less than a $0 savings in my tax bill. There's no savings, period. However, this time there's no mention of keeping our services local, as there was back in 2018 when we were discussing the communications center at our police department. We talked about being taken over by LA 911. At that time, we were talking about a $200,000 savings, and we wanted to keep it local. We need to keep it local. It was a strong, hard fight, myself included, and many people in this room included, to keep our communications center here. We did. We pay more because we want our local service. United Ambulance has no fixed facility, and where will their staff sleep at night? And if you don't think that paramedics sleep at night, I'm going to tell you, sorry, it's true. The fire stations don't meet codes, and they cannot be used for sleeping facilities. United Ambulance has continued to call Lisbon, as we've heard here tonight, for backup. You have heard that Lisbon has responded to their request more than they have to Lisbon's request. I'm not sure about the statistics that you were provided. I would ask how many of those were routine transfers in our community, like return transfers.
0.
Oh, excellent, thank you. When he talks Alpha, Bravo, Charlie, Delta, and Echo level calls, you need to understand that chest pain and shortness of breath is a Charlie level call. And they're not going to send a paramedic to a chest pain and a shortness of breath call, okay? That's one of those things. At least that's how I receive them on my call, okay? And again, this is all provided information. A training facility, as was quoted in the RFP, will not affect the outcome of the services in Lisbon. Lisbon holds a training at their station. Just this past weekend, their staff did required mandates that was given by their medical director. Training can be held anywhere, and this training center for United is used as a separate income-generating business. The same can be said about having a repair garage. Lisbon sends theirs to a mechanic, just like the Lisbon Fire Department does. These items should have no weight on our decision, none. Lisbon EMS has taken great strides in the last year to provide high-quality care, and this is only going to improve. The fire department purchased an ambulance under ARPA funds, and what we should really be looking at is how can the fire department assist when multiple calls are ongoing. We're hiring career firefighters for 450 calls a year. 177 of those were medical or rescue assist because they respond on Delta and Echo level calls. You approved funding to an equipped and advanced or paramedic level ambulance in the fire department last year. Let's work together for the betterment of timely services that will save or affect the lives of those in our community. I thank you for listening to me, and I thank you for respecting my comments. I do have a few questions. Do I ask them to you, through you, to them, or just to you, sir?
We're not going to do questions.
Excellent.
This is just, you make your point and
Roger that. Thank you, sir.
sit down.
I'm sorry?
Next. Sure.
Good evening, ladies and gentlemen. My name is Tom Garapy. I'm the Fire and Rescue Chief for the town of Bowdoin. I want to thank you for taking the time tonight. I think it was a little overwhelming a week and a half ago when you saw the turnout and how passionate we are about the EMS services in our area. I don't know where we fall on the spectrum of size of towns. Doesn't really matter to me. I'm happy to know that you guys are number 23 and you got a great police chief here, so and a great fire chief. I won't leave you out, Nate. I come to you tonight on a passionate level. I don't have a written speech. I want to make it clear, and I will back up what Chief McGee said about the change in behavior and professionalism of Lisbon EMS over the last 6 to 12 months. I've been through the good, the bad, and the ugly with them. I've been the chief for 15 years now. I've been on the department for 22. We started out, we've had our differences, but we've worked through them. Throughout the last several months, there's been some changes made. I've sat on a committee for the last couple of years with some of you folks, and some of you know my opinions. And I think those opinions are coming to fruition now, and we are looking at a brighter future. No one likes the cost value. One of the things that concerns me is that, and I have all the respect for United in the world because they have actually come to Bowdoin to save me before when I need an ambulance. I am stuck in a conundrum of being one of those communities without an ambulance service if United takes over, or potentially. On working with my select board, I've been tasked in previous years to go out and see who else will offer us EMS services. So far, I have drawn a big zero. Everybody's pretty much in the same boat price-wise, but what I'm looking for is quality of care. Lisbon EMS has stepped up to the plate for us, and they are providing that now. Additionally, as Chief Robitel said, they provide training for us, which is critical. I will be honest with you, I have 2 members right now, myself included, that run 95% of our calls in the town of Bowdoin. We're running about 140 EMS calls a year. Small pennies, but for big communities, they look at it and say, okay. But for us, when you're taking 2 members out and you're depending on Lisbon EMS to come in, they're a lifesaver for us. Case in point, tonight, we had a call up on the north end of town. Lisbon arrived. I'm on my way to the meeting here. That's why I was late. We had a second call. Now, normally, I have to ask who the next ambulance coming is. Lisbon sent an ambulance with 1 person to give me a hand tonight because I was the only person in town. That speaks volumes to me. Speaks volumes. So if I have to say anything to say, and maybe I can speak on behalf of the selectmen too, we want to be part of this process. If you choose Lisbon EMS, hopefully you do, in my opinion, and we certainly want to be involved in this. Thank you for your time tonight.
Thank you.
Thank you.
How you doing? Norm Albert, 76 Summer Street, right here in Lisbon Falls. I was listening on my ride back from Portland, and I was screaming questions that nobody but me could hear, but I thought you guys could hear me through the, I guess not. Fern, your mic was out. But all kidding aside, difficult process, and I certainly can appreciate the position that you all are in. It's not an easy one when you want to respect the bid process. I heard that very clearly, Mr. Robichaud. However, when I think about some of the things that were coming up, you all asked some great questions, but then you'd ask something and I would want to expand on it and nobody can hear me again, so I was kind of bummed. So I'm going to throw a few out there, but I'm not going to make it in a question form. I'll put it in my comments. That way I'm respecting what the chair has said as well.
Very good.
Thank you. Okay, so that being said, I heard some things talking about the bid process. So bid process aside, my thoughts on this was, is this an apples-to-apples comparison? Because when I listened to both pieces of it and kind of looked at some of the data, I didn't get that. Mutual aid calls to Lisbon. When I heard the question that one of the councilors posed, and forgive me, I don't remember which one of you posed it, but it was a great question about, hey, can you give us some details and data around some of the things, and this was posed to the United staff, here to say, hey, can you give us some details around calls and things like that? And that's not prepared here. Now, I am not trying to disparage anybody in a public forum in any way, shape, or form, but I think if you come for a bid, you want to come armed with all the details and even stuff that you weren't expecting them to ask. That's how I feel about that. So that was a big red flag for me. Understanding how many, if nothing else, mutual aid calls they provided to us would provide some critical detail like response times. Wouldn't that be a telling tale to understand if the other side, if you will, is saying that, well, 15 minutes plus or better to get from here to there? Well, if you have response times that show that are lower, that wouldn't be something I'd want to bring to plead my case. But that would lead me to believe that maybe that's the alternative might be the truth, and that, the speculation. I'm a data guy. Show me what you got, and that's going to work. The other side of that would be, what's the average response time of the Lisbon Mutual Aid, like I mentioned? Average tenure of your staff. That's another one I kept hearing back and forth, talking about number of staff versus number of staff on the other side, and different levels of service being provided versus the number being stated in the bid. One thing I would be pretty safe to, I'm going to put Lisbon Emergency on the spot right now. What's the average tenure of your staff, if you had to guess? How often do you see them turnover?
We don't.
Okay. So I would just say, if we're looking at that when making decisions about that, I want a staff that's seasoned, not 5 who just went through the 300 hours of training and then hopping out. And it's not to say that there's not value in that. People got to learn somewhere. On-the-job training is good stuff. However, when I'm thinking about what we're giving up versus what we're getting and the cost that we're saving. Thinking about that, United has more coverage area. So at times, in the event of multiple mutual aids calls and that they may respond to out of the Lewiston office, is it a possibility, because I'm not an EMS expert, not going to pretend I am, but could we be in a donut hole if they're out responding and their units are doing so, and they've got to keep a safety net behind? Because we all know, I've heard it from both sides, that it's a very unpredictable and very wild business where it could be quiet and then you could have 4 calls. So I just wonder where we land in that donut hole, and contract's not going to, can't point at a contract when somebody's dead. That's the end of that. Moxie Sports Activities, Chief hit this one earlier, and so we know that that's an outside cost. I guess this is my last piece of this. Public safety should be paramount. When I think about, we've added new positions as an organization, Town of Lisbon. We've added new positions at cost. And if we think about those new positions just in the town office alone, the cost associated with those, when we compare what we're trying to save, that's when I would start to kind of question if we're looking at the budget on a whole level and not just individually. I did hear some concerns regarding wanting to understand financing from our business partner with Lisbon EMS. And I think that where we have some leverage there is the fact that we have 2 of our members that sit on this board with them. So if we wanted to leverage that into a new contract to say we would like to have a more consistent budgeting piece, well, I'd rather go with a dance partner we know, and then we can just work out some kinks. I believe that if the council chooses the low bid in this case, it would be penny-wise but pound-foolish decision that would have major repercussions to the safety and the well-being of all members of our community, and mostly at a cost to all the families to go to sleep at night knowing that if they need EMS services, emergency EMS services, it is only a moments away during these situations when seconds are the difference between life and death. And thank you all for your time.
Thank you. Yes, sir.
Thank you. I'm Mark Bernier, Selectman for Town of Bowden, 21 Farm Road in Bowden. I've been on the board for 18 years, going on the 19th. I started here as probably one of the biggest naysayers of Lisbon Emergency when the crew came to us initially, and to you folks as well, needing money to support their cause. I asked to be on the board, and I've been on the board directors with them, the finance committee and everything right from the beginning. I figured that is probably the biggest way I'd be able to educate myself with EMS, not understanding it coming into here, and it certainly has done that. Everybody knows that EMS is in crisis. Rick Petrie was here with us all in the beginning. We can't afford for any EMS service to fail. I think Mark pointed out earlier, if you decided to go with United, then there is a chance that Lisbon could potentially fail. If Lisbon fails, then Bowden, which I felt in the beginning that Bowden and Lisbon were partners in this venture, then we're without an EMS service. Topsom cannot provide EMS service to Bowden. They can't provide EMS service to Lisbon or a lot of other communities. Again, because they're in crisis mode like every EMS service. So was a bit shocked that, when I heard at the board meeting about what was going to happen. I wish there were better communication ahead of time because, I feel that we're all partners in this and keeping this going. Lisbon has done a fantastic job. Lisbon Emergency, that is, has done a fantastic job boosting, their personnel and their plans this year. With the blessing of the board, which I'm part of, to hire 3 to 4 full-time employees to help bolster their coverage. I think with a very minimal increase in cost to both towns to do that. Their transfers and putting a second truck on has increased their revenue, which again I'd like to point out that Lisbon Emergency has been very good and transparent, giving us all of the numbers, both towns. What they do monthly, quarterly, and so forth. It's an open book. We have a seat on the board. We have a say in what's going on and what's going to happen with our communities and with the EMS service, and I think that's very important. I would just encourage other board members on your side of the fence, to get involved, if there are any questions. I know Chief McDonald has been very willing to answer questions, field questions, do whatever it takes to try and make everything work. And I think they've all done an excellent job in doing that. So I would ask for your support to keep us all going and go with Lisbon Emergency.
Thank you.
Thank you.
George.
Thank you. My name is George Roy, and I'm a resident of Lisbon, 7 Amalfi Street in Lisbon Falls. And I also am a director of Lisbon Emergency. I should also disclose I am the president CEO of the Lisbon Credit Union, and the credit union maintains a business relationship with Lisbon Emergency. When I was approached several years ago to join Lisbon Emergency's board of directors, I welcomed the opportunity to do so, as I had witnessed firsthand the importance of having someone respond quickly to medical events. I had been a coach on a youth baseball team when a pitcher took a batted ball to the face. I had an employee pass out at work. I'd seen more than one member trip and fall. Minutes in those instances seemed like hours when you're waiting for EMS personnel to arrive. I'm a strong believer in supporter of working together to offer a product or service. I think credit unions collectively in Maine do that better than most. I also believe it can be done at the EMS level. I believe this because we are already doing it. And I think here, this next point has just been brought out recently, but it needs to be emphasized again. As council members know, the town of Lisbon seats 2 representatives on Lisbon Emergency's board of directors. The town of Bowdoin seats 1. A few years ago, we all came to the conclusion, Lisbon Emergency, the town of Lisbon, and the town of Bowdoin, that relying on volunteers to staff EMS shifts does not provide the communities that we serve with an adequate level of EMS. So a detailed financial plan was put into place and accepted by everyone. Town of Lisbon, Lisbon Emergency, Town of Bowdoin, accepted by everyone. We attracted EMS staff by paying competitive wages. We upgraded our equipment, and the citizens of Lisbon and Bowdoin have benefited. The recommendation on the table tears down what Lisbon Emergency, the taxpayers of Lisbon, and the taxpayers of Bowdoin have built. The approach being recommended is not a lateral move. It certainly is not progress. It's a giant leap backwards. I urge the town councilors to not only think about the dollars saved by adopting the recommendation before you, but also think of the EMS qualifications of the people you want responding if you ever have to call 911 because your parent, your spouse, your partner, your child, or your grandchild is in need of medical attention. Thank you for your time.
Thank you. If anyone else has anything profound that they want to say,
The font size is directly.
they can step up. Otherwise, I'm going to close the workshop. Or I'm going to ask for a vote to close the workshop. Denise, please.
Sorry, if you're going to want this afterwards, it's kind of crumbled, but my name is Denise Doobie.
Hi.
I live at 111 Pinewoods Road in Lisbon. I've never done this before. I'm scared out of my mind, but I'm going to do it.
You'll be fine.
If it's
Just
something
stare at me when you...
No, I can't do that either. If it's something I truly believe in, I have to step up and have my voice be heard. I Googled for the definition of politics, which I don't do. I agree with Amy. It's not something in my wheelhouse. And it said the activities associated with the governance of a country or other area, especially the debate or conflict among individuals or parties having or hoping to achieve power. I don't like politics. I'm not here to do politics. I am here as a concerned citizen in the town of Lisbon. I want my voice to be heard and my opinion taken into consideration. I am in hopes that it will make a difference, but if I don't speak up now, I have no right to bitch later. Imagine my surprise the other evening while scrolling through Facebook and seeing the Lisbon community page with the information about United Ambulance and Lisbon Emergency. My first thought was, seriously? What is going on? I must admit, many, many years ago, I had my doubts about Lisbon Emergency and the service they could provide. Over the years, my opinion has changed. As with any business organization, the start can have some bumps in the road, but over time it grows and it blossoms. Having had to use Lisbon Emergency Services a multiple amount of times for my mom and my husband, I cannot imagine not having them so readily available. Time can make a difference when you're responding to a call, an illness, or an accident. Imagine it's your loved one needing assistance and the response can be from within the same town you are in, or it has to come from Lewiston. It's only approximately 8 miles, but that 8 miles in the time can make a big difference when your loved one is spiraling down. Just recently, we had to call 911 for my husband. He has congestive heart failure and COPD, just to name a couple of his health issues. Sorry, honey. The first time we called, Lisbon Emergency was out on a transport, so Durham had to assist. That took a while, and all we could do was stand there and watch my husband struggle to breathe, oxygen level going down, pain getting worse. Fire Chief Nate was there, which I'm thankful for, as well as some firefighters who had been around and local police. Once Durham arrived, they loaded him in the ambulance, started a CPAP, off they went, and understood United could do the same, but it's a timing issue. Rest assured, when we arrived at the hospital, more intense treatment began, and a quick response makes a difference. Less than a week later, again, the need for the 911 and Lisbon Emergency was able to respond. Immediately, they enter our home, comment, "You don't look good. Let's load you in, treat you on the way, and go." My mom has also recently used their services. Unfortunately, she has taken her share of falls. Lisbon Emergency is always quick to respond. Sometimes they do transport her, but other times they don't. I understand that some of you might think, well, any ambulance or responder will do the same thing. Yep, but will they be so close and in your own community? It's priceless. One of her falls was in her driveway on a hot summer day on hot tar in the sun waiting for help. What's your preference? Local Lisbon Emergency or waiting for United from Lewiston? She was also taken recently to the hospital during the winter storm and was discharged that same evening or morning at 3 a.m. When I got home, I had no way to get her in the house. Called Lisbon Emergency. They came, helped her in the house. It's priceless. It's local, it's convenient, and it's community. Lisbon has been my home for many, many years, and I'm proud to be part of it. When you hit rock bottom, this community stands by its people, its businesses, and its organizations. Just a couple of things to think about. Sometimes you get what you pay for. Be careful what you ask for. And my question to all of you, which has been posed by others, if it's your loved one needing assistance, do you want to have saved money, or do you want the quickest response available to be there and help them out? Thank you for taking the time to listen.
Thank you.
Sorry, it's so crumbled. It's okay.
I'm going to shut off comments. If anybody has anything that they want to say or forward to the council, they could email the town manager any questions or comments that they wish to add. We do have a big agenda up in front of us for the regular meeting, so I'm going to have to shut off the workshop. Is that
Okay.
a vote, or is that just?
That's not a vote. You can just close the workshop. Would you like to take like a 3 to 5 minute break?
Yes,
Before you start the meeting?
yes.
Okay.
Whack my gavel. Thank you for coming.
You're going to break that thing for sure. Love doing that.
All right, we're back to order for our regular meeting now, and I'd like everybody to stand for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, our first order of business is going to be, obviously, we've learned a lot of information tonight. We've heard some from both parties. I've learned some things. Some of the counselors that I've spoken with have also learned some things. So, as much as you're going to hate to hear this, we're going to make a motion to, or I'll entertain a motion to move 2023-72, awarding the bid to our next regularly scheduled meeting, which I believe is going to be the 16th.
That is the next regular meeting, yes.
Right.
So moved.
We have a motion?
So moved.
Mr. Fellows. And a second?
A second.
All those in favor? Okay. Thank you. And again, this is a matter of doing our due diligence. We did get a lot of information tonight. We're going to digest that. The Public Safety Committee is going to reconvene and go over some data that we learned tonight and concerns from the people that spoke, and we will have a decision on the 16th. So if you want to leave now, you're welcome. Otherwise, you can stay and watch the sausage be made. Pat, you're welcome to stay.
Hey, I got my bedtime.
I know. Bye. Bye.
What's that? Oh, yeah, it's warm in here.
Thank you, Amy, and thank you, Dennis. Dennis, thank you very much for your presentation. I appreciate it. Thank you. We will. Thank you. First item.
The first item, good news and recognition.
I'm excited to announce I would like to introduce our new finance director who's here tonight, Samantha Bryant. If you just want to come up, introduce yourself to the council and the community.
Well, good evening, everyone. It is really nice to be here. I'm really excited to have the opportunity to serve the residents of Lisbon and serve you all as your finance director. I've had previous experience, as I believe all of you know, working as a treasurer for various towns in Pennsylvania. And I'm just really excited after wanting to move to Maine for such a long time now that I'm in a position where I'm able to do that. And I'm just really glad to be working here and able to serve the residents.
Great.
Thank you.
Welcome.
Thank you. I have a question.
Sure.
Do you know where Fallcroft is?
I actually do not know where Fallcroft is yet. Where is Fallcroft?
Glen Olden, Sharon Hill, you know where it is. Sharon Hill, Glen Olden.
I was in
Delaware
Delaware
County?
County. I was in Buxton, Montgomery County, and it's like amazing. I don't know how here it is in Maine, but there's almost like an iron sort of wall between each like different county, and yeah, so I almost never interacted with any of the municipalities and the other, especially all the way in Delaware County.
Okay.
Yeah.
All right, thank
Sorry
you.
to disappoint.
No, no problem, no problem. I didn't expect an answer for that, actually. But thank you.
Good night.
Thank you.
Good
Good
night.
night. See you tomorrow.
Anything else?
No?
Next item.
Next item, public hearings. The first public hearing, school budget and CIP budget.
Sir?
Good evening.
Good evening.
Busy night, huh?
Yes, sir.
School never has busy nights at all. It's always
Oh,
quiet
it's
and peaceful, right?
Easy. Went over here was saying the same thing a minute ago. I said I can remember those days. So what I'd like to present to you tonight is just a quick update. I know I did my presentation last time in March. I provided you with a copy of the most updated ED 279, the subsidy comparison report, which is dated April 27th, 2023. So some of the numbers have changed, and quite honestly, a lot of the figures and stuff I'll go over, and then I'll be available for questions. The Lisbon School Department budget, which was adopted by the school committee last night, has changed since originally being shared with you in March. As a result of receiving additional state funding because of our increased student enrollment and also a software issue at the Department of Education, the Lisbon School Committee has been able to increase staffing to support the social, emotional, and instructional, and our recent English second language support services needs in the district. And the ESL, English secondary language services needs really came up last night during a presentation during a workshop in which we now have 18 students with limited English proficiency living here in Lisbon, and historically that number's been around 4, maybe 5 kids, and it's up to 18. And I know around the state, just based on our report last night, that there are more and more students in the area that are requiring those services. So that's one thing that with this budget, we were able to put in or set in at a one-time cost an amount of, this revised budget includes around $240,000 in professional services, and the majority of those funds are hopefully going to be used to analyze and address the infrastructure needs at the middle school. Because of our increased student enrollments, we have traditionally only had 4 classrooms per grade level at the middle school, and currently our 7th grade is one of 4 grade levels in which we have well over 100 and something students in. So it's a good thing, but it's also going to be a challenge for the district to be able to continue to have our enrollment numbers increase. Our numbers, as I shared during my regular reports, and I think I shared with you in March, our numbers have increased by close to 100 students since COVID hit a couple of years ago. And unlike a lot of districts in our area, our numbers are increasing, and it's a direct result of obviously the location, and any of you that are in real estate understand just how competitive and how tough the real estate market is in this area. It's one of the top 5 growing areas in the state. So the school department is having to deal with that. We're having to deal with the big part was the social emotional needs of our students, instructional needs. And so what we've added through my reports, we did add an additional assistant principal at the elementary school, which originally that was the plan because of the number of students there, and that should help with not just managing students, but also with providing instructional supports and observations, evaluations, and stuff for teachers. We added an additional special education teacher. We added a district-wide athletic director. And that position will allow both assistant principals are in the elementary school. They didn't have any athletic duties, but for those that may not be aware, the assistant principals at both the middle school and the high school, half of their job or responsibilities are athletics. So by having a district-wide athletic director, those 2 positions can be full-time assistant principals, traditional assistant principals that can focus on instruction, student behaviors, and then just teacher supports. As I shared with you in March, our primary goal was to not only maintain but to improve our current student programs and services, as recent data has now identified the negative impact that COVID-19 has had not only on our students' academic growth, but also on the social and emotional needs of our students and staff. Fortunately, the Lisbon School Committee was proactive in trying to address these concerns prior to the pandemic, and as a result, we have multiple resources available to deal with both trauma and curriculum-related needs. We've also been able to utilize our ARF, the recovery funds for the COVID relief funds, to help provide resources and supports to both our students and staff as we transition into the next phase. Last year, if you remember when I did my presentation, I had shared that we'd used a limited amount of those funds for staffing because those funds go away. And when you use those funds, you create what we call a cliff, a financial cliff, which means that if you use $250,000 of those funds for staff, and then the following year, when it goes away, you would need to use the $250,000 in those funds. You'd have to raise those locally in taxes. So if you look at the papers, a lot of surrounding districts, you will find that the majority of them are going to their town councils and going to their communities with pretty decent, pretty large increases. In the regional superintendent meetings, Lisbon is the only school district that's presenting a budget that is a decrease. Now, it's not a huge decrease, obviously, but it is a decrease. It's different than an 18%, 20% increase that you're going to read in the next few weeks. So the school department was, obviously, the school committee and school department is well aware of the current economic situation facing members of the community, and the additional state subsidy has actually allowed us to decrease the total amount of local funding required to be raised through taxes while increasing our current level of services and supports, which are very much needed. We're seeing some of the neediest students right now are actually in the lower grades, whereas in years past, a lot of times it's been higher grade levels trying to get kids to come to school. Now we're really struggling with providing supports and services for the younger kids who literally have lived in isolation for the last couple of years. So we've been able to, the school department has been proactive, in my opinion, of being able to add additional supports and services to try to address these needs. As you can see from the revised subsidy comparison report dated April 27, 2023, the proposed budget reflects a decrease to the Lisbon School Department local funding in the amount of $4,041 or 0.005% from 2022-23. As I mentioned before, although the actual decrease may not seem significant, the Lisbon School Committee has been proactive in the use of the ARF-related funds over the last 2 years, which has avoided the creation of the financial cliff, which I just talked about. Again, unlike many surrounding districts, Lisbon School Committee has been able to increase services, especially those that address those needs, social, emotional, and instructional needs of our students and staff, without having to ask the local taxpayers for additional local funding. Having the 200, using the additional funds that probably won't be there next year, that 200-something thousand probably will not be there next year. Having those set in the budget as a professional services, knowing it's probably a one-time deal, having those additional funds in there to really address the needs of the middle school, whether that's a new versus reno analysis. We're really looking at the building or facilities committee met a few weeks ago and looked at potentially adding an additional 6 classrooms to the building. You can actually attach them. If you haven't been to the middle school, there's actually space, but we want obviously an architect and an engineer to look at that and make sure we can do it. But by having that $250,000 in our budget right now, we'll be able to address that without having to go to a referendum, and it could really make a huge difference, and it would have us basically be shovel ready, which I'm sure the term is. So if state funding, a lot of times they're trying to regenerate building projects and stuff for schools that we would be qualified for, and if you're shovel ready, you're able to get the work done. Now, going back to that term, we've always had a very active facilities committee. The school committee has had a capital improvement plan. So we did a lot of that work. So right when COVID hit, we were able to use those ESSER or ARF funds to do all the heating units, windows, doors, and stuff at the school because we already had a plan in place. So when you have those plans in place and money becomes available, it's a lot easier for you to apply and be accepted and approved. So we know that the LCS referendum, the money that we're spending on the LCS community school, is coming off the books in 2 years. So we're hoping to have a plan in place to look at, have a plan in place so that when those funds become available, I can stand in front of you and the community and say, well, we're going to utilize, it's either 70 or 90,000. We can roll that into a bond. It won't cost you any more, and we'll be able to really do a significant project in the middle school because that is the focus. Over the last couple of meetings we've had, the middle school we've focused on the high school since I've been here, and now it's time to really focus on the middle school and try to get some of the improvements done over there. A common story that you may or may not be aware of is that when that school was built, they didn't have a library. The library where it currently is right now is actually supposed to be where the bleachers and stuff are for the gym. So that's why that gym it's so tiny, because they forgot to build the library when they made that building. So we have the old designs and everything, and so we're hoping to have like I said, hire an architect engineer to come in, look at our infrastructure, and then be able to tell us what we can do and what our options can be. And sometimes when they put, especially architects, when they design something, they put it in pictures, just like the new gym and the track. When you see it, people understand it better and are more apt to support that type of work, especially if you planned, or if they feel that you've taken the time to really look things through. So obviously that it wasn't an easy task, but I would like to commend the members of the Lisbon School Committee, the district administration, and staff for all their hard work and dedication throughout the entire budget process this year. And on behalf of the Lisbon School Department, I'd like to thank the members of the council and Lisbon Falls communities for your continued support over all these years. And at this point, I am happy to answer any of your questions. I did on the handouts for the public, I did put the 10-year history graph. I don't think that was sent to you. You just have the actual subsidy comparison report, but I did do the 10-year. And although we did have a decrease a couple of years ago, the majority of our budgets have been anywhere between 100 and as high as 500,000. So I know 4,000 doesn't sound like a lot, but in the end, it's a decrease.
Absolutely.
I paid attention when you said, I think it was back a month or so ago, when you said watch the other use of funds in other communities, and I have paid attention to the paper and watched the staffing going away or
That's horrible.
hand-wringing over it. So congratulations on having foresight to do it that way.
Yep. Yeah, no, we are actually going to benefit from that because our applications for our openings, we've been, with the exception of a couple for some reason, the majority of our openings have received multiple, much higher number of applications than they have the last few years, and I think we'll benefit from that because we're going to be looking to hire where other places, and people who know that they're funded, because you have to, anybody who's funded through federal money, you have to tell them that they're funded through federal money, so a lot of people that know that money's going away in a year are probably going to be looking this summer.
Very good.
Great job.
Thank you.
You're all very good job.
Any more comment? Seeing none, I'll close that public hearing. Thank you.
Thank you, sir.
Next item.
Next hearing is the itinerant vendor renewal for Riverside Flea Market.
I'll open that public hearing. Anybody want to speak about the flea market? There being none, I'll close that public hearing.
Next is the victualer's license for Pinky D's Food Truck.
I'll open that public hearing. Seeing no comment, I'll close that public hearing.
And the the fourth one is amend Chapter 10 Businesses, Article 5, Victualers, Section 10-292, C. This is the ordinance that removes the code enforcement officer from the inspection.
Dawn, are you all set with it? I know you had a question about the all set? Okay. Any questions at all about this? Any response? There being none, we'll close that public hearing. Next item.
Next item is audience participation and response to agenda items. At this time, those in the audience who wish to speak may approach the lectern to address items or issues that are on the agenda. Please use the microphone and state your name for the record.
Busy night, Norm.
Yeah, no kidding. Norm Albert, Lisbon Falls. I didn't realize it was a public hearing portion for the school piece, and by the time I did, you closed it, and they were walking out the door. But it was just more of a quick comment, and that is, it's great to hear that there's a reduction. However, the one thing I kept thinking about during this is that the school contract remains out, and they're still working on that. So that could have definitely an impact. If it obviously didn't get signed this year, it's going to get signed next year, and it should be considered that would probably have a significant increase. I know we've been fortunate enough that the state level, the government's committed to funding at 55% at least for the foreseeable future, but we still have a pretty big bill coming due next year. So more of a comment than a question.
Thank you.
I'm sure they'll prepare. They always do.
Thank you. Collective bargaining is always a crapshoot, isn't it? Anybody else? There being none, next item.
Next item is the consent agenda. Consent agenda items are considered routine and will be considered for adoption by one motion with no separate discussion unless a councillor requests an item be removed. Any councillor wishing to remove an item may do so now.
Mr. Chair, I'd like to have an item removed. That would be item N, which is a request for RFP for resurfacing of Littlefield Road.
Okay, is there a reason for that, or just?
Just that I'd like to have.
You just want it removed?
Yes, there is a reason. I'd like to discuss it, or have a couple of minutes of discussion before we routinely vote on it, because we haven't had discussion publicly on it.
Okay.
I'd agree with that.
Do you want to discuss it before we vote to remove it? or-
Traditionally, we'll vote on the consent agenda with that item removed, and then we'll
Take
move
that item
into.
out separately?
That's
Okay.
right.
Okay.
Okay. So we've removed item N. I'll read the items. The Order 2023-70 to approve the municipal accounts payable warrants, $344,180.23. The municipal payroll warrants, $250,784.42. School accounts payable warrants, $70,343.73. School payroll warrants, $357,539.02. The minutes of April 18, 2023. The renewal of the mobile home park permits. To extend the physical area and set a hearing for May 16th for special amusement license renewal for the Railroad Restaurant and Pub. The itinerant vendor renewal for Riverside Flea Market. Victualers and itinerant vendor license for Pinky D's Food Truck. To set a public hearing for May 9th for victualers licenses for Sweet Cakes Bake Shop, Anything Goes, and Smoke and Phil's Belly Bustin' Barbecue. To set a public hearing for May 16th for medical marijuana retail store renewal for Lisbon Cannabis and adult use marijuana retail store renewal for River Driver Cannabis Company. To set a public hearing for May 16th for medical marijuana retail store license for Smoky Falls. To request for RFP for 2023-005 road striping. And to set a public hearing for May 9th for the Union Street property.
Make a motion, we approve as written, as spoken.
I'll second.
All those in favor?
Order passed, 7-0.
Is it too late to change the date of the May 9th hearing to the 16th? Because that's the only item standing on that extra meeting. Since the school presented their budget tonight, we can do that on the 16th.
Yeah.
So I meant to, I didn't.
Typo.
Setting the hearing date, that can be changed. You want to change it to the
16th.
The 16th. Which
We don't
one
need
was
to
that?
meet the 9th.
Yeah, so
right?
you can now cancel the noticed meeting on the 9th because that was for the school budget, which was presented tonight and was noticed for the 2nd.
16th.
I'd like to ask a question, if I may, on what we just, so on L, where is Smoky Falls? Where's that business?
They haven't opened yet. Next door to Frank's, if you're
Okay, that's.
kind of
used to
across
be
from the
electronics
railroad
store.
pub. Mhm.
Got it.
They've been working on it for a while.
Okay, got it.
So item N.
Item N, Don.
The reason I brought it up is I'm not quite sure where we are with that. I spoke with Glenn briefly about it, and I think he cleared it up mostly, but I thought it should be worth a public discussion. So, Glenn, have you?
Sure. So obviously Littlefield Road is part of the 2023 road resurfacing, pending the approval of the municipal budget. Obviously, there's no funds appropriated for that project. So I was going to bid it out on July 1st, but after talking with the public works director, I guess historically we solicit RFPs now so we can get on a paving schedule. So we're not looking at doing resurfacing in calendar year 24. So this is just to go out to bid for the resurfacing pending approval of the municipal budget, and that this is.
And my question resolved in, because I remember this brief discussion that was in workshop, the comment has always been made that that thing should be completely reworked or rebuilt, and paving it is a waste of time. And then we sort of in the workshop changed our mind a little bit, but so I'm not sure how much of it is getting paved or what the RFP will encompass, and that was my question.
So I have the bid spec. I haven't gone through it yet, and obviously putting it in the agenda packet is not appropriate because then bidders can see it before the RFPs go out. I can confer with Randy and make sure the spec is, well, we have time, I guess we have time to discuss it. I'm just requesting an order authorizing to go out to bid.
Based
so.
on the bids, we can decide whether we accept it anyway, so, yeah.
Right.
Yeah, I think Randy left that off of the schedule in an attempt to keep their costs down. And I know that putting it on would be a significant increase in the mill rate. And I know that there's a CIP that we're looking at, and there's a paving schedule. And if we mess with that, it kind of pushes it off, and we're going to have to do it eventually. So we either pay now or pay later. I think that would have generated, what, a 2 mil increase? Does that sound right?
You mean the rebuilding it?
Yeah.
Yeah.
Right, so I can confer with Randy on the spec and what we're...
I guess we won't know until we get the bids, but
right.
I think his estimate was pretty significant.
Like
800, wasn't it?
475, I
800
think, was
plus?
what he was looking at.
Yeah, that was actually for, and again, I agree with Don, it was actually a lot of different discussion, but I mean, at one point I know there was the possibility of totally removing the asphalt, grind it, and then actually reapply it, roll it, then actually pave over it, not just a mill and fill. It was actually a, you know.
It'd still be cheaper than a full rebuild where you redo the whole.
It was still under 500.
Yeah. I think that was in the context of that 500,000 we were talking about, you know, you could fit that in as.
Yeah, he was gonna dig it all up. I believe, Public Works is gonna do some of the work to keep the cost down. I believe, that's what Randy said.
Yeah.
Because they talked about grinding the hot top and actually reusing it as a base.
Yeah, and then.
But actually use it as a base roll, right?
But anyway, we're gonna put it out for bid, right? And I guess the question that Don has is what's a bid for what?
Yeah, exactly.
I guess.
Let me find his...
I guess Randy knows. I mean, I guess we can do everything from patch it to redo the whole thing, so.
So this came in today. I can just... Give me a second. We'll pull it up. So it's to reclaim 17,665 square yards, regrade and compact, pave 2.5 of 19 millimeter base, approximate 2,500 tons, pave 1.5 inches of 12.5 millimeter surface, approximately 1,500 tons, grade shoulders, and provide driveway aprons, road 7,225 feet by 22 feet.
Okay. That's clear as
Okay.
mud for me, so.
2,000 square,
It
2,000
sounds-
feet by 22 feet. Is that what you said?
No,
7,225 feet by 22 feet.
That's, yeah, okay, so that's over a mile.
Yeah.
But the description is actually removing the hot top, grinding it, using it as reclaim, use it as a base, then repave. It's not just a grind and fill.
Right.
Yeah.
So I
Okay,
guess we'll
so
find
we'll
out.
wait for the bid.
So I'll make a motion that we go out for an RFP for that project, and then we get a second and we can do it.
Okay.
I'll second that, Don, if you want to keep moving forward with it.
Well, gotta do something.
Sounds good.
All in favor?
At least see what the numbers are, then we always can work at it from there.
The vote was 7-0. Mr. Chair, I see that when we removed the item N from the consent agenda, we had a motion by Councillor Fellows and a second from Councillor Lunt, but we neglected to take a vote on that.
Didn't you say any counselor could have it removed at request? It wasn't.
I still have to have a vote on it, though.
Really? Okay.
Well, let's vote
I'll
on it.
double check on that for next time.
Let's vote. You want to vote on it? Let's
That'll
vote
make
on what
me
we didn't
feel
vote
better.
on. All in
Okay,
favor?
thank you.
Yes.
Don't think you do.
I agree on what we didn't do.
Okay. Sorry about that.
No problem.
Okay.
Next item.
Council orders, resolutions, and ordinances. So per Lisbon Ordinance Section 74201E7C abstentions, where a councillor intends to abstain from participation and voting on a particular item, they shall advise the other councillors present as soon as that item is placed on the floor of their intent not to participate and to abstain from voting and the reasons the abstentions required. First order, 2023-71, Ordinance Amendment to Chapter 10 Businesses, Article 5, Victualers, Section 10-292C. This is a second reading and will require a roll call vote.
Make a motion to approve?
Second.
Any discussion? We're ready to vote.
Councillor Kane.
Yes.
Counselor Fellows.
Yes.
Counselor Keller.
Yes.
Counselor Larishel.
Yes.
Counselor Lunt.
Yes.
Counselor Moore.
Aye.
Counselor Robichaud.
Yes.
7 yeas, 0 nays. Order passed, vote 7-0.
Next item.
Order 2023-72. That was to award this emergency services bid. We've already taken that vote to move it to the next meeting.
Thank you. Next item.
Order 2023-73, the transfer fees, transfer station fee changes. This is a first reading and will require a roll call vote.
Make a motion for discussion.
Second.
And this is to bring it to that $50 or $52
52,
figure.
isn't it?
Yeah, $52 figure.
$52.
Is the finance director's memo in the packet? I was just
Yes,
gonna read
that changes it from $35 to $52 annually, and this will also set a public hearing for May 16th.
So do you want me to read the memo from the finance
No,
director?
no, it's fine. I was just so verbally we could,
Okay,
people would
yeah.
hear what we were
It took
doing.
a
That's
little digging to understand
all the
how we
dynamics.
arrived at the fee, and that was outlined in the memo. So if you
Yep.
read it, it's in the packet.
All those in favor?
Roll call, I believe, right?
Oh, well, I'm
Yes, it
sorry.
is a roll call. I
Well,
know.
you said,
I'm sorry.
You said second reading, but this doesn't say second reading.
This one's a first reading.
First reading on that.
Okay, Counselor Kane.
Yes.
Counselor Fellows.
Yes.
Counselor Keller.
Yes.
Counselor Larishel.
Yes.
Counselor Lunt.
Yes.
Counselor Moore.
Aye.
Counselor Robichaud.
Yes.
7 yeas, 0 nays. Order passed, vote 7-0.
Mr. Chair, may I ask a question?
Yes.
When would these changes take effect? Would this be in the first, after July 1st, or?
Yeah, so my understanding is Public Works will send out to the users a flyer or a notice. So resolving the fees before July 1st is helpful since we need to notify the users that it'll be going up effective July 1st. So
Right, and we still have a second reading and then 21 days from the second reading, so.
Yeah. It's just good for people to hear what we're doing, that's all.
Next,
I have a question. What if I go, let's assume this takes effect July 1. Just hypothetical.
it'll take effect 21 days after the second reading.
Okay.
So in time for July 1st.
Okay. So what if I buy a sticker a week before that?
When your next sticker's due, it'll be the next price.
Okay.
Mr. Chair, I think,
Yeah.
I thought those were next year's fees. When you buy your 23, 24 sticker, that's what would be the
I think you're right, Counselor Fellows. I think,
It
I
is.
wasn't in the discussion, but it
Before
makes
that.
sense because the dump stickers are all due at the same time.
Right.
And typically you can buy that after July 1st. So.
Mhm.
They all expire in August, and then, like Dawn said, it goes from August to the following August.
No early specials.
So, yeah, no
Early bird
program.
special.
Okay. Thank you.
Next item is Order 2023-74. This is an ordinance amendment for post-construction stormwater management. It's a first reading. It'll be a roll call vote.
Make a motion for discussion.
Second.
I believe this is a non-option for us, right? This is basically part of the,
Yep, this is a statutory requirement. I do not understand the nuances of stormwater management in the MS4 yet, but Kara Ballinger and the engineering folks are on top of it. And I think, and I'm not sure if it's this one in particular, but there is some litigation going through the state where some of these may be delayed, but we're just doing what the state is requiring of us to do the MS4 program.
we don't fit into the criteria, but we got fit into the program, and now we can't get out, so.
Correct.
And essentially, we're
Options.
just repeating what the planning board already did.
And the code enforcement officer asked me to pass on that he is working on changing several fees on the fee schedule that have to do with this. But those will be at a later vote and maybe after the other questions have been answered.
Any other discussion? We're ready for a vote?
Counselor Kane?
Yes.
Counselor Fellows?
Yes.
Counselor Keller?
Yes.
Counselor Larishel?
Yes.
Counselor Lunt?
Yes.
Counselor Moore?
Aye.
Counselor Robichaud?
Yes.
7 yeas, 0 nays. Order passed, vote 7-0.
Next item.
Well, I'm so sorry. I don't have a motion and a second.
I did, and Fern did.
Fern and
Thank you.
Dawn.
I knew somebody did it, I just didn't have it written down.
All good?
I was taking a lot of notes during that workshop. Next item is Order 2023-75, Ordinance Amendment, Chapter 54, Article 3, Swimming Pools, Section 54-71, Definitions. First reading, so it's a roll call vote.
Motion for discussion.
I'll second that.
This is the one that eliminates the 250 cubic feet or square feet or something, water. It eliminates that one criteria on the measurement of a pool so that it meets and goes along with the rest of the accepted standards. Nowhere else is there listed a 250-foot minimum. If I'm correct. Am I correct on that?
I didn't
Yeah.
understand any of that.
Hi, Bill Cool, Planning Board Chair. So this is an amendment so our town standards meet the state standards again.
There you go.
There is no set size of what a pool is. It could be a bucket, as long as it's an impermeable surface that doesn't let water through, and a bunch of other criteria as well. It's just making our standard meet the state standard.
And may I ask a question?
Sure.
Now, is this,
Keep in mind, I think this is dumb, but...
yeah, is this a change needed because there's been a concern or some type of different?
No, it just says when we were reviewing regulations, we wanted to make sure as often as possible we were in compliance with the state standards. I don't know that anyone's complained about the size of their pool or what we call a pool. This is just something we're doing, trying to clean up the...
I believe it has to be 2 feet deep anyway, right?
Yeah,
By state
the
standard.
depth, but not the square footage.
Does this actually change the permitting for like a kiddie pool versus a big pool? It doesn't change any of those permitting processes, right?
No.
Basically.
No, because it speaks to impermeable surface in the regulation itself. A kiddie pool still being just basically a plastic bag with a frame. It would be something else altogether.
Does the requirement for a fence play into anything like any?
No, this is just what is the
Just the
description.
definition of a pool.
Yeah. Taking away a square footage thing that we had left in it from some time ago.
Sounds good. You ready for a vote? Thank you.
Thank you, sir.
Councillor Kane.
Yes.
Councillor Fellows.
Yes.
Councillor Keller.
Yes.
Councillor Larochelle.
Yes.
Councillor Lunt.
Yes.
Councillor Moore.
Aye.
Councillor Robichaud.
Yes.
7 yeas, 0 nays. Order passed, vote 7-0. Next item is Order 2023-76. It's an ordinance amendment, Chapter 70, Article 4, District Regulations, Division 14, Dimensional Requirements. Section 70-536, Table of Dimensional Requirements. This is a first reading. We'll take a roll call.
Make the motion
For discussion?
for discussion.
I'll second that. Mr. Chair, I'd
That's
love
a
to actually,
footnote.
yeah, I'd love to have a planning board up
Can
again.
somebody
Yeah.
talk to us about what this is?
Talk about the footnote.
This was just another amendment correction to an existing regulation that Mark, our code enforcement officer, caught while he was doing other things. We're just changing it to make it in compliance with other existing standards.
Do we know what the dimensioning is actually referring to?
Yeah, that was
Is
a
it
pretty-
I do,
property,
because I had to
houses,
look it
or-
up a million
I'm drawing a
times.
blank, so I'm glad Lisa.
So what actually happened was the little teeny tiny footnote number was incorrect and pointed at the wrong footnote. So the correct footnotes were there, but the little teeny tiny number pointed at the wrong one. So he had to correct it. It corrected it something that didn't have anything to do with the column it was
Doesn't
in.
change.
It didn't change anything. It just, if somebody was looking at that table and was looking for the correct information, they wouldn't have been pointed to it. So
And then, unfortunately, it's a planning board chapter 70 zoning thing, which requires a hearing and all of that, and then come to the council and do the same thing all over again.
So, may I ask a question? So when it comes to stuff like this, as far as for just directions or subnotes or punctuation or spelling, do every one of those changes actually need to actually have amendment? I mean, what is the limitations of what can be changed just
yeah,
at the planning board?
they have to be amended.
Any change to
We
the town
said so.
statute, especially when it's referring to a different piece of substatute.
But you're not really changing it, right? You'd actually
We're
just
not changing the
reference.
substance of it at all. It looks, in looking through, it's been that way for a long time, so in looking through, it may very well have been a typographical error the first time it was made.
I was just curious of what level actually needs to be, because I'm sure we go there and find thousands, if not
Yeah, there's,
hundreds, right?
yeah.
You can propose a tiny number amendment to it if you want.
You could do, if you wanted to go concentrate on Chapter 70, you could amend all over the place with it if you wanted to, probably.
It just seems strange that we're actually
It's,
hitting just
not
small,
get carried away.
small
Making the
notes at a
sausage,
time,
right?
you know,
It's,
but.
yeah, you know what, what's preferable is, and I think council's already discussed this, is to review whole sections at a time and make all the changes needed in a section at once. And I think that's something the planning board's working on in that Chapter 70 anyway.
Mr. Chair, may I make a recommendation? Since we actually have paid help staff that actually probably could do this very efficiently and without guidance and just overview of the planning board. I mean, this to me sounds like a great opportunity for our planner to actually just take this and review it. I mean, it seems to me, I don't want to say that we don't love seeing you, but if you have to come up here for every one of these different changes individually, we may see you a lot.
And my term does run out in June, so let's.
But either way, you would think there'd be a more efficient way of actually just reviewing and actually making sure that everything's.
Yeah, we've been fixing them as we came across them, but I agree. It's easier to make a wholesale change to a whole chapter or a whole section.
I believe the planner's working on the ROS 1, ROS 2 situation now, so that's an opportunity to make some major revision. Maybe the minor ones could be made at the same time.
Often we don't come across these things until someone brings something forward and saying,
It's a problem.
hey,
Makes
it's a
no
problem.
sense.
Yeah. Understand. I'm all good with it. I'm just saying it'd be one of those things we've been shown that there's many areas that need to be corrected or updated, so why don't we just do it?
We agree. Planning board I can't speak for everyone, but I would think that we would rather do this all at once. Things like this and the stormwater mandate that we really don't have a choice about are just things we have to shove through the process.
I do have good news. So previously, when we send this information to be codified, we're charged by the page. And Municode has changed how they do the billing, and they've looked at the past 3 years of how much we have in a year on a monthly basis. They split it up into a monthly basis, so we're being charged basically by the month now, so we can make all the changes we want. It's not costing us any more. So it didn't cost us more to do the little ones, but it is more advantageous time-wise to do
And since you
more at
dragged me
once.
up here, I will say we do appreciate having the planner. She is very useful, very knowledgeable. She's been helpful in several areas. It's good to have the extra expertise and time for people who don't, because as you know, this is my other job. People who know the details of everything they're looking at instead of people like myself who have to learn everything from scratch. So she's been very helpful to have aboard.
Very good.
And hopefully, if I may, Mr. Chair, to say as the planning board chair that you're going to continue again after this term, I'm sure.
I'm term limited out, I'm told.
Either way, I just hopefully if there's any questions at the planning board or recommendations, they come forward and request it to us. So.
Yep, that's the plan.
Yep, thank you.
Thank you.
Thank you.
This will be a roll call vote, if you're ready.
We're ready.
Councillor Kane?
Yes.
Councillor Fellows?
Yes.
Councillor Keller?
Yes.
Councillor Larochelle?
Yes.
Councillor Lunt?
Yes.
Councillor Moore?
Aye.
Councillor Robichaud?
Yes.
7 yeas, 0 nays. Order passed, vote 7-0.
Next item.
Next item is other business, council committee reports.
School committee.
Nothing to report.
Also nothing to report.
Planning board.
Just the ordinances you just saw.
Lisbon Development Committee.
Nothing to report.
Conservation Commission. Nothing to report. Parks and Recreation.
Their meeting was moved to next Monday, so for the next meeting, I'll have a report.
County Budget Committee. Nothing to report. Library Governing Board.
The library is gathering gently used books for a book sale to be held Moxie Days in collaboration with the Methodist Church. They will also, of course, accept nice jigsaw puzzles.
I donated 24 puzzles.
Yes.
I don't do puzzles. I collected them up.
Where are you gonna store all these books that people bring in? Do you know?
You can drop books off at the library, and then books will be taken to the Methodist Church for storage.
Okay.
Because they have the storage to accommodate the books.
Very good.
Thank you
Thank
for the
you.
question.
Water Commission.
Meets next week.
Finance Committee?
I'm meeting this month, so I'll have something next time we meet.
Yeah, you meet on the 8th. Charter requires review of the municipal budget and CIP, so this is that meeting per the charter requirements.
Town Manager's Report?
Sure, got a couple things. So, most pressing, the recent storms have damaged the Burroughs Road Bridge, the one that we've submitted for the CDS earmark for replacement to the Congressman's office, which made it through the first round, which is good news. So the Public Works Director today met with a bridge inspector for the state. After the inspection, he suggested that the bridge be closed to a single lane, traffic only, and lowering the posted weight and installing jersey barriers on the westbound lane. Eric Calderwood from the state is going to be writing a report with weight limitations and a recommendation for new construction options. I'll know more tomorrow or this week about next steps. I guess the thing that's hanging out there is whether or not we may need to do this now. I have the finance director looking into options, and we have a call out to bond counsel about how to do that. The good news is if we get the CDS, that's 100% paid for by the federal government. The thing that I also have to weigh is whether or not we use a FEMA disaster declaration, but the thing that's going back and forth is if you take the FEMA money, you may not be able to get the CDS. So I have a call out to the Congressman's office to kind of weigh how we're going to reimburse ourselves for this work, and also figure out the funding component. But I just wanted you to know that happened since this storm and something we may need to do.
A question on that. If we were to close the bridge, and then people couldn't get to Bowdoin,
that would be a really big problem.
Would Bowdoin have to step in and help? Since they can't go with school buses or anything, pick up the people that they need our bridge to go over. It just seems like a very odd scenario where we're all stuck for the bind for a bridge used to access Bowdoin more than Lisbon.
Yeah, and I don't know the history here. My understanding is it was part of the CIP plan. It was scheduled at some point, needed to be replaced. Unfortunately, this storm accelerated that, and that's why we've been exploring options through Congressman Golden's office, and now obviously this FEMA money is an option, but the plan was to go for the CDS. Obviously, we may have to do it sooner than later. So,
I know back in the day the same thing happened, that one big storm we had, and we actually had to do a temporary bridge there because then you couldn't go through all the way into Bowdoin. I think you can now.
No.
You can't now? It's still
No, this has
impassable?
never been approved. It stops. So Bowdoin's school buses and everything still have to go through that bridge to pick up students at the other side. So most of the heavier restrictions will affect Bowdoin people more so than they will affect Lisbon. So that's
I mean, the good news is that I don't think we'll end up paying for it, but we will maybe need to front that money before we get reimbursed by the feds. And I'll come back to you when I know what those options are.
Okay.
So the other thing is we've been, obviously, with spinning up the Rumbo site, we're planning on having more programming and events. We had the Easter egg hunt recently, which kind of brought up some questions that we're having more events in town, and our ordinance doesn't really address it. So I'd like to convene an internal staff committee to review our mass gathering ordinance and just make sure it's appropriate and that we're anticipating kind of the externalities that we're going to see when we start having more events. And we'll come back to council, or I guess the planning board, with a recommendation on how we should modify our mass gathering ordinance. If you read it now, it's kind of quirky. I believe it refers to after-hours events only from like 12 to 6 a.m., and it's a different component of the ordinance. And also, as we kind of work through those nuances, working with our partner, the Friends of Rumbo, because they're going to obviously hit pain points with our mass gathering ordinance, and kind of just been doing some research and seeing what other towns are doing, and just kind of, that's the plan at least, meet internally and come back to you with a recommendation. Because we're seeing costs too. We had to close that road for the Easter egg hunt, which was great. We had a nice event, but that meant a Public Works on-call person coming in and paying them, and we don't have anything in the fee ordinance or the fee structure to kind of address when we're eating some of these costs for trash removal or whether we need a road crew from PD or something. So it's time to kind of revisit that because we're seeing more requests for that type of programming. So this is just kind of an update. So as we were doing the CIP, Randy kind of let me know that the plow and wing that we were planning on replacing next year is looking at a 2025 based on supply. So the cost is comparable. We were looking to just plan the sweeper replacement with the plow to the next year. It's not a cost difference, it's just an availability thing. But I just wanted to kind of give you an update. There were some new hires. We hired a collections clerk who accepted the offer today, and we promoted Amy Scribner to tax collector, who was on the agenda for appointment later. We have another offer out pending acceptance, so hopefully that office will be fully staffed in the next 2 weeks. And that is all I have, unless there's any questions.
No, thank you. Next item.
Next item is appointments. First is 2023-77, the order to appoint Rick Roberts as warden for the June 13th, 2023 election.
If we have to, I'll make that motion.
I'll second it.
All right.
All in favor?
Does a wonderful job. I'm sure he'll.
He does. He's a real asset when on election day. He's great with people, and he does a really good job. And so order passed 7-0. Next order 2023-78 to appoint tax collector Amy Scribner.
I'll make that motion.
A second.
All in favor?
So I just want to say it was nice that we found somebody internally that we could promote from within.
That's good.
And, you know, this was just to go back. This was something that we identified back in August. It was a position that existed, and it went away. And me and Kayla, the previous finance director, had recommended bringing it back in next year's budget. And then with the vacancy that happened in the collections clerk position a couple months ago, we were able to fully fund the position a little bit sooner with council approval back from the last meeting and cover that portion of it with overlay. So just some background info for folks that are unaware.
All right. That order passed 7-0.
Rick Roberts was also one of the original police explorers.
Oh, was he?
Back in the early 80s.
I believe you.
Just a little nice to know information.
Is it when we get Rick as warden, we don't just get Rick, we get his wife
Rick.
Cindy, and they're great people to work with, and they do a good job. That's good.
Next item.
Council Communications.
Anybody have anything for him?
I do. I know Ross was chomping a bit earlier, maybe there, but there is a event happening in town this weekend. Ross, you want to just touch base on it? Because we were going to mention it. I was hoping it was going to come up during the Lisbon Development Committee discussion, but.
That's okay. So this weekend, as I mentioned at the last council meeting, we have a Jane's Walk happening in two parts of town. It's a historical stroll along the banners, co-hosted with Positive Change Lisbon and the Historical Society. Al Smith will be walking along telling us about the photo on each banner, what building that refers to, and what it was like when that building was in place. We'll start at 10:30 at the Graciano Square and do it for an hour down in the village, and then we'll move to Lisbon Falls at 12:30 and do it again down there, following with a sort of open house at Olive Pit Brewing with some of the Historical Society materials laid out for folks to look at. So it'll be an interesting day to take a look at the past of our town.
Thank you, Ross.
Thank you.
Very good.
Sorry, when I looked at Ross, I forgot something in my town manager's report, if I can just touch on it. So when we moved that hearing for the Union Street property, I just wanted to give the council kind of an update. That's the building that was destroyed due to the fire back in February. So we have been working with the property owner. This is to set the hearing for the dangerous buildings. He was set to be served by the sheriff this week for notice of that. But we are working with putting the owner in touch with a developer to maybe get that taken care of before we have to escalate to the point of actually doing the dangerous buildings hearing. And I'm heard that those negotiations ongoing between the developer and the property owner are promising. So
Good.
My hope is that'll be taken care of before we actually have to take formal action.
Anything else?
Yes.
Okay.
I just wanted to say It is certainly controlled chaos on Main Street, but it is controlled, and I found it that they are doing an excellent job at controlling traffic and doing their jobs, and I just wanted to give them a thanks for that.
Thank you.
You're welcome.
I want to say that myself and the town manager will be attending the Ross.
Ross is here. Let's keep calling on him.
Once you, I should have asked you while you were up there, but tell me why I'm going there.
Late last
And where is it
fall.
again?
It's at the Androscoggin County Building tomorrow night at 6 p.m. So the Spirit of America Award that we awarded to Tony and Tracy Austin gets recognized again by the county for all the recipients. So tomorrow night at the county building in Auburn, there'll be a reception to recognize all of the county award recipients. So the three of us are attending that. It'll be a great event. Thank you.
Thanks.
While I'm on that note, if I might, publicly we are putting out requests for this year's nominees for the Spirit of America Award. It's on our social media page. You can look at the Lisbon, and several pages have shared it. We're asking the public to submit nominations for this year's Spirit of America awardee. We'll review that in-house and pick select a recipient by your June meeting.
Great. Thank you.
Thank you.
Next item.
Next item is audience participation and response for new items. At this time, those in the audience who wish to speak may approach the lectern to address items or issues that are not on the agenda. Please speak clearly into the microphone and state your name for the record.
Norm.
Busy night. Norm Albert, Lisbon Falls. So while these, my question was regarding an item that wasn't on the agenda, it did get brought up, so I wanted to address it. And so that is, I heard the town manager speak about the events that have happened down at the Warumbo and a cost associated with that the town has had to bear. Did I hear that right?
The cost that I've seen was due to the road closures for more party events, the Easter egg hunt. That was a private event on
open door Bible for the Garley Street.
Yeah, but I just, with foresight, just wanted to kind of do an overhaul of that ordinance to kind of make sure we don't incur those costs.
Okay, and that's why I wanted some clarity, and thank you, because I was misunderstanding. I thought you were saying it was in relation to the Warumbo event that happened. And so I think it's important that we specify and break that out. Well, at least in my case, I wanted to understand that a little bit better, so I appreciate that. Aside from that, the only thing I wanted to mention, that this was an item related to what we talked about, so I'm going to break the rules a little bit. And that is, we did pass an ordinance a couple of years back regarding dump passes. If somebody was to buy one in the last 3 months of the run, that it gets prorated. And forgive me, I don't remember the exact wording, but if you look at the ordinance, it says if you buy it in that third month prior to August, then it's going to be this rate. So how that might be impacted based on what Lisa had said, when we land and get 21 days past the actual piece, that may or may not impact. So it might get a little squirrely for the girls up front to have to figure that out, but aside from that.
They already have a plan. I think they already have a plan to address it once it goes into effect. So I don't know what the plan is, but I think they do.
Okay. Good point.
And internal hire, awesome. That's great news. Thank you.
Thank you. Anybody else? Next item.
Next item would be executive session, but we have none, so the final item is Order 2023-79 to adjourn.
I'll make that motion.
Second.
All in favor?
Order passed, 7-0.
We are adjourned.
8:30. Don't break another one, Harry.
Power is freaking gone to his head. Yeah, I think you're right.
Flying off the time.
I keep expecting that thing to go fly.
That's what I'm trying for, Mark.
I think I better duck.
I'm going to be on TikTok or something, right?
I suggest
I'm
we
gonna fly
hide
hit
it.
right in the head.
Right.
Safety glass.
Knock his
Where
ass
the
out.
sun don't
Be
shine.
like,